Call the meeting to order. All right. Deputy Clerk of the Board, could you conduct a roll call?
Absolutely. Supervisor Brown?
Present.
Good morning. Supervisor McCowan?
Here.
Good morning. Supervisor Haschak?
Here.
Good morning. Supervisor Juror?
Here.
Good morning. And Supervisor Williams?
Here.
Good morning. Thank you.
All right, so I'm going to conduct this in the Pledge of Allegiance. And the flag. Okay, ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so I'm going to announce for public comment, in order to speak via telecomment, one must submit a speaker form online before 8 a.m. the day of the meeting. The link to the telecomment request forms can be found on both the first and last pages of the meeting agenda and on the Board of Supervisors website under Agenda and Minutes and Public Engagement. If you have submitted a telecomment request for either public expression or consent calendar, please call in now. So, agenda item number 3, public expression. So I see some people on the list for public expression, 3A. So are those people on the line?
Yes, Chair Haschak. This is Deputy Clerk of the Board, Atlas Pearson, and the first on the line is Karen Osland.
Okay. Good morning, Ms. Osland.
Good morning. Good morning, Chair Haschak and Supervisors. My name is Karen Osland, and I'm a resident of the 3rd District. I've been a member of the county's Tobacco Coalition for 3 years, and during that time, we've been working to bring a revision of the county's tobacco retail licensing ordinance to the board for consideration. My purpose today is to request that the updated ordinance be placed on an upcoming agenda for consideration and adoption. The current ordinance dates back to 2008, before the invention and widespread use of electronic nicotine delivery systems, also known as vaping. The current ordinance does not make any reference or apply to liquid nicotine and vaping devices, which is the prevalent means of tobacco use among today's youth. California has made incredible progress on reducing the number of smokers, but vaping has emerged as the nicotine delivery method of choice, and our youth are vaping in high numbers. For example, 21% of 9th graders in Willits, where I live, report that they currently use electronic cigarettes. This is according to the 2018-19 California Healthy Kids Survey. An updated tobacco retail license will help address youth vaping, which is an indicator of long-term tobacco use with lifelong health implications. The cities within Mendocino County also need to update their ordinances, which will be an easier task if the county would lead the way. The health of our youth should be a priority in a community that cares for its youth. Adoption of the updated tobacco retail license ordinance is supported not only by the Tobacco Coalition, but has been approved for submission to the board by the county's Health and Human Services Advisory Board. There will never be a perfect time, and there will never be a better time to take significant action toward keeping nicotine out of the hands of our children. Please place the tobacco retail licensing ordinance on a future agenda. Thank you.
Okay, thank you, Ms. Osland. Yeah, I was part of a committee working on that before the COVID hit, and it got way late with the COVID. So we hope to get to work on that soon. All right. Next, I'll pass this over to Atlas.
The next caller on the line is Emily Goldstein.
Good morning. Good morning, Chair Haschak and the Board of Supervisors. Thank you so much for listening this morning. As you heard, my name is Emily Goldstein. I'm the North Coast Regional Coordinator for RISE, the Rural Initiative Strengthening Equity, as well as a member of the Tobacco Coalition here in Mendocino. And I wanted to talk this morning with you all about the impact that tobacco and nicotine use have on COVID-19. So those who smoke or vape can experience much more serious effects from respiratory illnesses. In the past, this has been seen with the flu, but it's no different with COVID-19. Many health officials, including the CDC, encourage quitting smoking, vaping, and avoiding secondhand exposure as an important preventative measure and a way to lower your risk of serious complications from COVID-19. Additionally, smoking weakens the immune system and can put smokers, especially older adults and other vulnerable populations, at greater risk for contracting COVID-19. The second point that I wanted to touch on this morning with you all is the way that youth are affected by vaping and flavored products. So although youth are not considered a vulnerable population when it comes to COVID-19, they are experiencing the negative effects of the vaping epidemic. And what I mean when I talk about the youth vaping epidemic is that youth vaping rates are on the rise. High school students past 30-day use of e-cigarettes or vapes rose from 11% to 27.5% from 2017 to 2019. And this is producing a whole new generation of nicotine addicts. 4 out of 5 kids who vape nicotine use flavors, and 15 to 17-year-olds are 16 times more likely to use vape devices than those older than them. So in large part, this can be credited to the fact that e-cigarette and vape devices are sold with flavored products that are targeted directly at children. And the tobacco industry has a long history of using flavored tobacco and flavored products to draw in youth and create a new generation of consumers for themselves. So tobacco retail licensing ordinances that include a ban on flavored products have worked in other locations to protect youth from children, and for children and teens living in areas with strong licensing requirements, there is less of a chance that they'll even begin using e-cigarettes or traditional combustible cigarettes in the first place. And over 30 cities, municipalities, and counties in this region have adopted bans against the sale of flavored tobacco products. Again, after the implementation of a strong tobacco retail license, youth rates have decreased over time in those areas. Thank you so much for your time this morning.
Okay, thank you.
Next on the line is Larry Olson.
Atlas, who was that on the line?
Larry Olson.
Hello. Good morning.
Yes, good morning.
My name is Larry Olson, and I'm the current chair of our Mendocino County Tobacco Prevention Coalition. I appreciate the chance to speak with you, and the two previous callers as colleagues expressed exactly what we wish. The need within our county for a comprehensive tobacco control mechanism where this control product needs to be managed in a responsible way so that people who sell it and all of those who are involved with its supervision have a uniform set of guidelines. That's what our proposed ordinance will provide. The problems that have come along, as Karen and Emily described, regarding the development of all of these new products, which are directed at our children, is the primary focus as far as our youth addiction. Throughout the county, we, however, do also need uniform kind of guidance so that the activities in one place regarding the sale of tobacco are the same as they are in others. So that is the reason that we brought what we feel is a very carefully prepared and ready to be approved ordinance. The pandemic, of course, stopped you, and with good reason. And frankly, Your service is appreciated, whether you get the credit that you deserve. However, we would ask that since we don't see a reasonable point at which we would return to normal, that your board consider bringing our proposed ordinance onto an agenda as soon as you could possibly do that and go forward with its adoption. And I do thank you for the opportunity to speak.
Okay, thank you, Mr. Olson.
The next caller on the line is Abby Colbert.
Good morning.
Hello, good morning. My name is Abby Colbert. My husband Larry and I live in the unincorporated area of Fort Bragg. And I want to say first, I'm so sorry to bother you at this time. It is so upsetting to watch the news. We own a mini storage with many tenants, listening to their many challenges, and we know a lot of the business owners over here. So I just cannot apologize enough for bringing up something unrelated to these issues. However, we've had a problem that's gone on for well over 5 years. I had a discussion with Julia Acker, who's now head of the planning department, when the adjacent property owner was building a home. And I said, we're worried it's going to be a vacation rental because that's a principal permitted use if you're in the coastal zone in the RR2 residential zoning. And she said not to worry because that's an issue that the planning department is going to be looking at shortly and rectifying. And the reason that she said that is because in our county, we have two zoning areas, the inland zoning code and the coastal zoning code. If you're in the inland zoning code and you want to operate a vacation rental and you're in a residential zone on a private shared road, you have to apply for a major use permit. If you're in the coastal zone, however, and you're in the same situation on a private shared road in a residential zoning, all you do is pay a few $100s for a business permit and register for transient occupancy tax, and bada bing, bada boom, you're in business. The adjacent property owners have nothing to say. We have no way to protect ourselves. We've lived next to 7 different vacation rentals in different locations over here over the years. And most people are nice, but sooner or later there are problems. Somehow, when people come over to our beautiful area, they're excited, they're paying a lot of money, they want to get their mileage out of it, and something they're Thank you for unmuting me. Somehow when they come over here and they're in a group and they're excited, and I think alcohol has something to do with it, they do things they wouldn't normally do. Shooting guns, fireworks, driving cross country, letting their dogs off leash to chase the deer.
Was that the time for that?
Yes,
That
it
was-
was.
She timed out?
Twice, yes.
Okay. Okay, thank you, Ms. Colbert. Are there any other calls for public expression on 3A?
Yes, Chair Hashak, this is Atlas Pearson, Deputy Clerk of the Board. We do have one more caller. It's coming in as unidentified, so I'm going to go ahead and let them in and ask them to identify themselves, if that's all right. Caller, please identify yourself.
All right. Well, maybe we'll come back. And I just wanted to say that we do have a lot of calls about 5B, and that's the CEO's report. And it seems like a lot of these calls are about the embedded report from the Cannabis Department. And so we are going to take those calls right after the CEO report instead of a general public comment.
Mr. Chair?
Yes, Supervisor Brown.
Thank you, sir. There has been a lot of public comment through emails on a number of items throughout our agenda today. But under public comment, I just wanted to point out from the Redwood Valley MAC, their information on vehicle fire prevention, and staff appropriately tied it to item 6B. So I'm going to be bringing that up as a part of item 6B.
Very good, thank you. All right. Do we have that caller on yet, Atlas?
Let's see. Caller, please identify yourself.
Good morning. This is Becky Emery. I'll hold on for the report on the COVID-19 response.
Okay, thank you. All right, so moving on to consent calendar, agenda item number 4. Okay, clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, are there any items for separate consideration? I see Supervisor McCowan's pulling 4A. I'd like to pull 4B. Are there any others? Okay, hearing none. Supervisor McCowan, 4A.
Yes, Mr. Chair. So there's one statement that I think is not factually correct towards the bottom of page 1. The whereas, it says Mendocino County has been profoundly affected by several natural disasters. And it says coastal sea rise with severe impacts on coastal nearshore ecosystems. I don't claim to be an expert in that area, but I haven't seen coastal sea rise being a direct impact, particularly in Mendocino County yet. I would suggest putting in front of that clause or that phrase, and is at risk for coastal sea rise. Also, the parenthetical phrase right before that refers to first devastating wildfires and then parenthetically and accompanying days-long power outages. The power outages are related to the wildfires, but were not mostly directly caused by them. I would suggest the parenthetical phrase could more accurately be and related PS events. If those modifications are acceptable, I have one more change on the final page.
I would second that. Chair Haschak, may I?
Yes, Supervisor.
Yeah,
Williams.
Supervisor McCowan has some good ideas. I would second it with the condition that we write out public safety power shutoff rather than the abbreviation.
Certainly.
Supervisor Jurdy.
They're acceptable. I would just remind everyone that the Hall Road, which was a logging road converted into a park trail north of Fort Bragg, partially washed out and was one of the reasons, and the primary reason that state parks gave for removing the Hall Road north of Ward Avenue was the damage caused by sea level rise. But I'm not going to quibble over the language. I think it's Supervisor McCowan's suggestions are fine.
Okay.
Mr. Chair?
Yes, Supervisor Brown.
Thank you very much. I think there's also been some issues in the Point Arena area with their harbor as a result of ocean rise.
And aren't there issues with the water in Fort Bragg with the sea rise going up the Noyo River?
It is true that in low flows of the Noyo River that there is some brackishness in the water of the Noyo River where they draw the water out. But I don't know that that's specifically to do with sea level rise, but it has more to do, I think, with just the droughts.
Oh, okay. Okay, and we're good with that then? Supervisor McMillan.
Yes, and also I think Point Arena, it's been more extremely dramatic winter storms that have caused a lot of havoc in the harbor periodically. Maybe that is directly related to climate change. So anyway, I'm good with that either way, but I think it may be more accurate to say and is at risk for. Sounds like those are acceptable. I have one other on the final page. It would be the third paragraph from the bottom. And I think it makes an overcommitment of what Mendocino County can do, since it says that we commit to ongoing education and active engagement of all county staff, members of committees and commissions, contractors, consultants, residents, and independent county groups in alignment with the goals of mitigation, drawdown, and adaptation. And so I don't think we can make that commitment that all of those entities will be in alignment. I think we can certainly make the commitment for ongoing education and active engagement, but later in the sentence after community groups in alignment, I would suggest community groups to encourage alignment. So we're engaging with all of these to encourage alignment with the goals of mitigation, drawdown, and adaptation.
Okay, Supervisors Williams and Jurdy, are you all right with that?
True, you can't guarantee everyone's going to agree. So I think Supervisor McCowan's suggestion is probably more accurate.
Agreed.
Okay. All right. Then with those changes, we're all right with 4A. Okay, so I had pulled 4B. It's just, I wanted clarification on that because this came from Supervisor McCowan, and yet Supervisors McCowan and Williams are on that committee. So I wanted to make sure that Supervisor Williams was all right with disbanding and that any information had been provided.
Yeah, I think it's a good idea. That ad hoc was formed, but not utilized.
Okay, so we're good with disbanding it. All right. Are there any public? There was public comment on item 4A. Okay, so Atlas, is Susan Schur on the line?
No, Chair Hashak, she is not on the line.
Okay. All right, so then is there a motion to approve the consent calendar?
Yes, Mr. Chair. I will move approval of the consent calendar, noting, or rather incorporating the changes to item 4A.
Okay, is there a second?
I'll second the motion.
All right. Deputy Clerk of the Board, could you conduct a roll call vote?
Yes. Supervisor McCowan?
Yes.
Okay, so that was Supervisor McCowan.
It looks like his phone is disconnected temporarily.
So we'll just need to take a moment.
Okay.
I'd just like to say to the deputy clerk, sorry, I thought you were saying Brown.
No worries.
You cut out.
Deputy Clerk Lindsay Dunham, I could see how they sound similar.
Also, I was temporarily off the line. This is Supervisor McCowan. I am back on. Don't know if I was called yet.
We're gonna start over again, Supervisor McCowan. So let's start with you, Supervisor McCowan.
Yes.
And Supervisor Jurdy.
Yes.
Supervisor Williams.
Yes.
Supervisor Brown.
Yes.
And Chair Haschak.
Yes.
Thank you. The motion carries unanimously.
All right. Thank you. Agenda item 5A, discussion and possible action, including an update associated with the novel coronavirus, COVID-19, including possible direction regarding essential services in Mendocino County, operational preparation and response, and associated countywide economic impacts. So the sponsor is the Executive Office. I'm going to look to CEO Carmel Angelo.
Thank you, Chair Hashtag. This morning, I will be giving you a brief update followed by Becky Emery, our Department Operations Center Manager. And then we will have Jason Wells from the Adventist Health System, who will also give you an update regarding the hospital system and the healthcare delivery system. I do not believe we have an update from Deputy CEO Darcy Antle today. And our health officer, Dr. Duan, I do not believe is available at this time. So I'll go ahead and start and turn it over to Ms. Emery, and then, if okay with this board, Mr. Wells. And then I am not certain if we have code enforcement on or not. I'm going to assume that we do. So I'd like to go ahead and start, and then we'll go from there. So just a couple comments I would like to make to this board. Regarding the numbers and our status, I will leave that to Ms. Emery. But I would like to let the board know that with Supervisor Hashjack's good work, we have been contacted by the Willits Chamber of Commerce. And I think some of you may know this, that the chambers have all been working together. And I believe they're working also with Visit Mendocino on a campaign called Mask Up Mendo. So I spoke with Mr. Moorhead from the Willits Chamber, and the chambers would like to do this outreach and education regarding masking and our public health event. And so it sounds like this will be, extremely useful to us to really help get the message out. And they do have this model of ambassadors, as Supervisor Hashtag has spoken about before. And so I think that this is something that will certainly benefit the community. Along with that, I spoke with Patty Bruder from North Coast Opportunities, and NCO is also willing to yet one more time step up and assist the community and the county. And so what we may be able to do is look at North Coast Opportunities to outreach and educate specific target groups, and the chambers doing the overall public and the businesses. So I am waiting for a proposal and a budget from the chambers, specifically Mr. Moorhead, and also from Ms. Bruder from North Coast Opportunities. And I believe that this could be a model that marries up nicely between the two agencies, and we could really blanket the county. So I'm excited about that. I would like to personally thank Supervisor Hashtag for his work with this, and hopefully we'll have something soon from both of these agencies. I would also like to ask this board that there is one concern, only one concern with this outreach and education campaign, and that is that do we really want to target tourists? And there is a component in this campaign, as I understand it. I'm not the expert on this campaign, I can say that. And some of you may have more information on this campaign than I do. But my understanding is there is a component in this campaign that is a Mask Up Mendo that actually reaches out to tourists. And before I certainly would bring something to the board to authorize county dollars to go for a campaign for tourists, I wanted to understand what the direction from this board would be. There are some counties that have actually started campaigns in a very nice and friendly way, saying, please don't come to our county. And so for us to have a campaign to invite tourists in at this point in time really may not be the way this board wants to go. So I don't know if the board would like to give me comments now or later. That's fine. But I do want to bring this to your attention that I don't feel comfortable putting money towards a campaign attracting tourists if that's what this is. And so I will bring that to the board before there would be any decision on that. So also I would like to say that over the weekend, I'm sure everyone saw the press release that we put out, which listed 4 different businesses with outbreaks or potential outbreaks. And there is another process that Dr. Duan has authorized that we utilize, which is the CDC process for business outbreaks. So that's what we have been working on and what we worked on over the weekend. And county staff worked with these 4 businesses and others actually throughout the weekend. But I think what we will be seeing is more of a trend where 1 or 2 employees become positive for COVID in a business. And what does that mean? How do we continue to provide technical support to that business, do the regulatory work of public health to assure the public's health, and still do everything we can to keep that business open? So that certainly will be a challenge going forward, and one that we're all working on. So one of the activities that we are just starting is having a reopening visit from environmental health. As we all know, environmental health works with the businesses and certainly does certification and regulations around the businesses and around their processes to assure that they are within environmental health guidelines. So Trey Strickland, who's our environmental health director, is starting a certification when we have a business, such as the businesses that we had over the weekend that are shut down either for cleaning or for investigation of the employees or where the outbreak is. Before that business reopens, environmental health will go out and work with that business and offer technical assistance to assure that they are taking all safety precautions and to educate them if there are additional safety precautions that they could take. And so we had that happen with our first business over the weekend. So I think this will be a really good service, but what it speaks to is the multiple outbreaks throughout the county. It's not only individuals, but now businesses, which certainly we know we've had some businesses, but after this weekend with having 4 businesses and working with 4 at the same time, we know that this is an area of need that we need to work on, and we need to work on quickly. The other piece of working with the businesses and getting the businesses reopened has to do with investigation and contact tracing. So we have a training today. We have 22 employees and volunteers who are in this training, which is assisting them in learning the software, the CalConnect software, which is something that we're using for contact tracing. So we're doing everything we can to pull more people in. We've requested mutual aid from the state, and we are going to be receiving that as far as additional state staff to help with contact tracing. So regarding the business outbreaks, I think we're going in the right direction with that. What I would like to say is that the ordinance that the board adopted some time ago, which allowed for a fine with the public health order and moving from a misdemeanor to an infraction. There was some question about enforcement with that, and there was some comments by some of the board members about utilizing environmental health. So I have asked Mr. Strickland to help with that and have environmental health assist with enforcement as well. But I also want to say that at the same time, we've now given them another assignment, which is working with the businesses to assist them in reopening. So between enforcement and reopening of businesses, I have them doing reopening of businesses as the priority first, since we have 3 arms of enforcement. So I want this board to know what's happening because I know it's of great interest of this board. Additionally, John Martyr from the Special Investigations Unit will be bringing forward an additional contract for an outside vendor security company to help us with enforcement. And that really will be for isolation and quarantine. The more days that go by, the more we see a need for working to keep people who are non-compliant and COVID positive in an area where they're either isolated or quarantined, and we can protect the public's health. So I think we have multiple activities happening around enforcement and also around business outbreaks. And so I really wanted to use this opportunity to let the board know that. Along with that, I would like to let this board know that Dr. Dewan has been working with the state on two fronts. One, of course, on the watch list, which I'll speak about very briefly here in a minute, and also around testing. We know that testing is needed and wanted on the coast. And I would like to also comment that Supervisor Juror and Supervisor Williams have really stayed on us about assuring that the coast has all the testing that they need. We know that we cannot get another OptumServe lane on the coast. One, is cost prohibitive. And for those of you that are following OptumServe now, you're seeing that OptumServe here in Ukiah is like every other location where they're running out of test kits and there are more people in line to be tested than they have resources for. So, you know, we are no different than any other part of the nation when it comes to testing. And our hope is that we can work through this. But at the same time, we're not able to access a second lane of OptumServe on the coast. So Dr. Dewan has been working with the state, and the state offered Dr. Dewan an Abbott testing machine. Now, what we know about the Abbott testing machine is that it is not appropriate to do surveillance testing. However, the Abbott is used for people that are symptomatic and for outbreak testing. So Dr. Dewan contacted the Coast Clinic, and the Abbott machine is going to the Coast Clinic, and we have 300 free test kits. So, you know, we're very pleased and very very happy that Dr. Dewan was able to get this. And so that Abbott machine with the 300 free test kits is going to the Coast Clinic for them to do testing as needed for symptomatic and outbreak testing. Our hope is that we will get additional free test kits from the state, but right now we have 300 with the Abbott testing machine. We also got an extension of the UCSF contract, and that will help with outbreak testing and testing in other areas other than Ukiah. Excuse me. So I wanted to give the board this update around testing. We've made some progress, and certainly some progress with testing on the coast. I think I've spoken about the business outbreaks and certainly the environmental health role, and then also some additional efforts with enforcement. My question again to this board, and it doesn't have to be answered right now, but what are we going to do about tourism, and are we going to continue to promote tourism, or is that an area that we would rather not promote at this time? And then finally, before I turn it over to Ms. Emery, regarding the watch list, Dr. Dewan took an action over the last few days that I think was a bold action, and one that certainly some have questioned. We've been talking about the watch list and honestly trying to stay off of the state watch list, but recognizing that we are, just a few steps away from the watch list. One, we have had recent deaths. Two, we have had hospitalizations that we have not had before. And three, our numbers have gone up approximately a dozen every day over the last few days. We are over 200 right now. And again, Becky will be talking about that. But if you look at the numbers, you look at our surge, you look at our uncontrolled community spread, it's only a matter of time before we would make the watch list. So what Dr. Dewan did is she took local control. And as this board knows, whenever we can maintain local control and not turn it over to the state, we do. And so what she did is she moved ahead with an order that includes all of the direction that we would get, or the requirements that we would get from the state if the state put us on the watch list. And of course, that order does not go into effect until this coming Friday. Dr. Dewan has been talking with the state just about every day, as evidenced by this new Abbott machine that they've given us. And it appears that the state is actually somewhat pleased with Mendocino County and our proactive efforts. And so right now, because we are taking the same action that the state would take if they put us on the watch list, right now there's no indication over the next couple of days that we will make the watch list. So the good news for the public to understand is local control means the regulations have come from local government. The regulations could be removed by local government. If we did nothing and we just sat back and waited for the state to put us on the watch list, we would have to wait for the state to take us off the watch list. So I'd like to say that to give this board and the public a greater understanding of the health officer's efforts here, not only to keep the public safe, but to maintain local control. So with that, unless there are any questions for me, I would like to go to Ms. Emery with our latest numbers for this board, and then go to Mr. Wells to do an update on the healthcare delivery system. And I would just ask Atlas, as Ms. Emery gives an update, if you could please get Mr. Wells on the line. And if you have difficulty with his number, let me know. So thank you. I'll turn it over to Ms. Emery, if that's okay with you, Supervisor Hashtag.
Well, if I could just jump in there for a second. You know, I've been working with the Chamber of Commerce from Ukiah and Willits, and I certainly believe that Fort Bragg's Chamber of Commerce is involved in this Mask Up Mendocino program. They aren't trying to encourage tourism, and they just want those tourists who are around to know the importance of masks, you know, in their time of vacation. And so it keeps our businesses and communities safe. So I think that that's what their attempt is. So I don't think they're trying to encourage tourism at this point. And,
thank you.
And I see that Dr. Doohan is on the line. So I wanted to make sure that you knew that, CEO Angelo.
Yes, I did. I wasn't certain if she would be on or if she would be on long enough to say anything. So if you would like to, if Dr. Doohan would like to say anything now, if not, we could go to Ms. Emery. So thank you.
Okay.
Maybe we should move to Ms. Emery, Chair Hashtag.
Okay, Ms. Emery. Okay. Becky,
Well,
are you online?
I know she's there.
Dr. Doohan. Okay.
And Carmel, this is Jason. If
Yeah,
if
why
you
don't
would
we?
like me to fill the gap.
Yes, that would be great. Thank you.
All right, Mr. Wells, good morning.
Hey, thank you, team. I appreciate the chance to share with kind of a real time. I just got off the phone with all three hospitals. As you know now, we have all three hospitals served by one leadership team here in Mendocino County. We do have 100 beds in the county. 16 of those beds are ICU beds. We have about 45 ventilators in the county, but being a part of Adventist Health, we have over 1,000 ventilators at our disposal should we actually need that many. And our hospitals have been sharing resources across the state throughout this. Today, we have 8 patients in the hospital that are COVID positive. 3 of those are at Howard. 3 of those are at Ukiah, and 2 of those are on the coast, and both of those are related to the Sherwood Oaks situation there. And so 8 patients in-house. We have 2 of those are in the ICU. And so we feel, the team has been doing a great job caring for those patients, and we're down from I think our highest we got to was 10 over the weekend. So we've had a couple of discharges, which is always great when people can go home and continue to recover safely at home. Listening to the governor yesterday, I noticed that 9% of our beds, we have 73,000 beds in the state in hospitals, 9% of them are filled with COVID patients. We're kind of right on track with that, with 8% of ours filled with COVID patients, being that we have 8 inpatient COVID today. Taking a look at our ICU bed, we have 16, and so only 2. So we've got plenty of capacity there. San Benito County has 0 ICU beds free this morning. Placer County has only 16% of their ICU beds. And so we're doing really good compared to some of the other counties that are out there. But I was taking a look at the COVID Act Now website today, which Stanford's a part of that. And I know many of you probably use that as a good resource. It projected we'd have 10 hospitalizations today. We're at 8, so it's pretty close there. And when I take that out, if we lift all of our precautions and just go back to business as usual. 137 hospitalizations in Mendocino County are projected on August 20. So if we keep doing what we're doing, they say that 21 hospitalizations on August 20. So no worries on the 21. We have that capacity. 137 would be a different story. So we appreciate what everyone's doing to flatten this curve. Certainly gave us more time to get ready. We've been learning from LA. We've been learning from all the other places around the country that had this come first. And our hospitalists, our physicians, I feel, are doing a great job keeping us ready. On the testing front is one of our biggest challenges. We do have both the Abbott and the BD system here in Mendocino County. All three of our hospitals have the Abbott system, and we have the BD up at Howard. The challenge is, as you know, the Abbott is really good if you are symptoms. It's not as sensitive of a test, and so it can pick up the virus. The sensitivity is much better on the BD system, so we're running all of our asymptomatic on that machine. And the challenge is just getting the reagents. And so we are probably getting 10% of what we could use. As we're following the CDC protocol, which is patients who will be hospitalized, our first priority. We found quite a few COVIDs of people who were zero symptoms, just were coming in for other issues to be hospitalized and were COVID positive. They had no idea. And had we not been able to test them, we wouldn't have known that either. So that's an important step that our patients across the county, we have 70 patients in our three hospitals today. So that's an important population that needs to be tested as they're coming into the hospital. Symptomatic is the second one. Symptomatic individuals, that's critical. That's physician preference, but the guidelines from the CDC are symptomatic over 60 with chronic medical conditions. I know our physicians write orders for under 60 when people have symptoms, but that is the CDC guidelines there. The third one is symptomatic healthcare personnel and first responders. So Ted Williams, I saw something on Facebook over yesterday. I appreciate your comment saying I can't imagine that's true, because I can't imagine it is either. We certainly test every healthcare worker that has symptoms. I don't know of any situation where we refuse that. And so if you ever come up with an individual, would love to follow up on that. But that is our intent, is we have helped with clinic personnel, we've helped with hospital personnel, we've helped with sheriff, with police, with fire. It's been a great partnership. Number 4, persons requested by the health department. So we've had a great partnership there, and Becky and I have worked closely, and we have continued to test anyone. Our BD and our Abbott can turn things inside of a day. Usually it's 2 to 3 hour turnaround. So we have been happy to be able to step in and get that covered. And then the final one is pre-surgical patients. So we're doing around 40 to 50 surgeries a day between the three hospitals. So it's really important to test that population prior. Obviously, a lot of times intubated or breathing tube put down their throat. And so anytime you're doing an invasive procedure like that, you want to know if a patient has COVID or not. So those are the 5 that we have been doing. And like I said, we could use 10 times the reagents. And so it would be nice to see something coming out of DC where we are, helping Abbott, helping BD ramp up their production through some executive orders like we did with ventilators early on, because we're all set on ventilators. I don't lose any sleep over too few ventilators. It's the reagents that are the challenge there. So again, final update would be on PPE. We are doing well. The county's been a tremendous partner, helping us get key equipment at times. We are sharing resources between our 24 hospitals. N95 masks are probably the only one that continue to be very hard to get our hands on, but we've never had a situation in Mendocino County that I'm aware of where first responder, where staff have had to go without of anything and not use the proper, we followed the CDC guidelines on everything. So feeling good about our surgical gowns, about our gloves, about our standard masks. But we continue to have only about 6 to 7 days out on the N95s, but those have continued to flow in. So we're doing okay there. Remdesivir, I can tell you our county works miracles. We have had remdesivir come to our county when Sonoma couldn't get it. And others. So I do not know of a patient who's not gotten a treatment of remdesivir that needed it. And so it is incredibly short supply around the country, but we have been able to take care of Mendocino County well when that antiviral drug, which is so important in this process, has been requested. I'm happy to take any questions anyone might have.
Are there any questions from the board for Mr. Wells?
Yes, Mr. Chair. John McCowan here. So we currently have 70 patients total in the hospital, it sounds like, including those who are COVID patients. So currently we have 30 open beds. Would that be accurate?
That is absolutely accurate. We also have surge planning that takes us to 200 beds. And so I'm just counting the actual beds that are not part of any surge plan. So correct, 70 beds are free. And we have, what would that be? 14 ICU beds are free. And then additionally, we have a virtual hospital that Time Magazine is going to cover this week. So some national coverage for Mendocino County. 25-bed virtual hospital has been set up, and that has 21 beds free. And that is a hospital where patients are cared for in a full acute status in the comfort of their own home. And we're sending a care team in multiple times every single day, and we're monitoring them 24/7.
Well, thank you. It does seem like we are in good shape on the hospital capacity front. And I hear you saying that the primary difficulties for the Adventist system is short lead time on N95 masks, so maybe a 6 or 7 day supply, and only able to get 10% of the reagent needed to assure timely testing of the test samples that you've taken.
Yeah, we have timely on the one we're able to do because it's usually about a 2-hour turn. But what we would like to do is test, all we have 1,500 employees between the 3 hospitals and on the 26 clinics. We would like to be able to systematically continue to test all employees. We'd love to be able to offer that to, Mendocino Community Health Centers, to the Coast Clinic, to Anderson Valley, to Bechtel Creek. That would be the dream scenario, is that we are testing all healthcare personnel, even fire, first responders, EMS. Those, we just don't have the capacity. We're just barely keeping up with the CDC's guidelines on those 5 things I outlined. So it is a national problem. Because Mendocino County is doing better than most, when you look at a lot of the cases per 100,000, we look pretty good. Compared to most places in the country. So when Abbott and BD and the people doing the allocations, when they see Mendocino County and then they see LA County, they go, well, my goodness, we got to make sure everyone in LA County. So they meet the LA County order before they meet the Mendocino County. Now, we've gotten better than what we would have because of other Adventist health hospitals have been shipping and sharing their allocation with us. When they don't have, the crisis that Glendale and Bakersfield and some other hospitals have. But that is the challenge, is we are getting a very small amount of what we're ordering. And dollars don't fix that. It's not, it's purely, it's an allocation. That's a crisis of supply.
Right, nationwide. And one more question. Our attestation document was prepared, submitted May 18th. The triggers for adjusting the modifications related more directly to our current level of infection and so forth. So our experience with COVID mid-May, which was quite a bit different from what it is now. And it doesn't seem like those original triggers were related directly to the capacity of the healthcare system. I'm pretty confident that if Mendocino County were to make an effort to update that portion of its attestation document, you would be fully cooperative in detailing all the things that you've described here regarding our healthcare system capacity.
Oh, absolutely. We feel confident that, again, if we continue, if these projections are right, and the 21 hospitalizations on August 20, we are ready to care for that population and more. We were only 9 away from that a couple days ago. So the teams are ready, and we're happy to help update it and let let the state know all the things that we've done to be ready for this moment. Yeah, absolutely feel confident that we'll be ready.
Thank you.
Are there any other questions?
Yeah, Jason, can you talk a little about how patients who are COVID positive but not needing to remain at the hospital get transported home? Are we doing what we need to between the hospital, public health, other partners to make sure we don't spread infection as people make it back home to recover?
Yeah, that is a great point. I believe that great partnership. EMS team has been exceptional. They will often know of if we've had to, we've transferred COVID patients but to higher levels of care at times, and we know of no transmission of COVID from patient to staff in the back of the ambulance in that process. So feel they're doing a great job wearing their PPE and doing everything that they need to do to stay safe. So when a COVID positive patient is transferred home, they go on home precautions, and the health department has been an exceptional partner on that contact tracing team, checking in multiple times a day, just making sure that patient has what they need. I know our team checks in as well to make sure that they're doing well. And I don't know of a single instance where we've sent a patient home and then they've come back because they took a turn for the worst. I think that everyone that's been sent home to their home setting, of course, we all know of one individual that went to a long-term care facility. But if they've gone to the home setting, people have done very well and recovered at home.
All right. And I have a question, Mr. Wells. That you talked about, we have 100 beds and then we can surge up to 200. But on Friday night on the town hall with Representative Huffman and Senator McGuire and Assemblymember Wood, you talked about, I think the number was 145. So I'm just wondering what the difference between the 145 and the 200 is. Is that using that virtual hospital model?
Correct. Part of that. So the 145, we had to attest that we could go, I think it was 35% above to kind of meet the threshold. So that is the 45 exceeded that by 10. That is a plan that we feel very comfortable with. The 200 is, absolute crisis where we stop doing all surgeries. We take over our ORs. We take over our PACU, which is our pre-op and our post-op. If those of you that have surgery, you get cared for before surgery in an area, then after surgery in another area. The 200 takes over all those areas. So that's kind of a full crisis mode where we are really just caring for COVID patients. Part of those surge planning looks at, we can't just only care for COVID because other people continue to have challenges in the community. So, looking at, is there, where do those patients go, and keeping obviously beds available for just life, pre-COVID type issues that we need to care for. So the 200 is by far the pulling out all the stops. The 145 is what we're really comfortable going to. We can do the 200, but the 145 is what we attested to the state to.
Okay, thank you.
You bet.
Okay, not hearing any further questions, so thank you for your time this morning.
Oh, absolutely. Thank you for all your work.
And moving on to Ms. Emery.
Good morning, Chair Hashcheck, CEO Angela, members of the board. Thank you for the opportunity to share with you on our Department Operations Center in response to COVID-19. I'm Becky Emery, the Department Operations Center Manager. We are currently at 207 cases in Mendocino County. 89 of those cases are current individuals in isolation. 81 of them are in their homes, and as Jason Wells just shared, 8 of them are currently in the hospital and 2 in intensive care unit. We have supported 4 various outbreaks throughout the community. As CEO Angela shared earlier, Sherwood Oaks has been a phenomenal partner in their response to the outbreak, following all of the CDC guidance as they've isolated and quarantined their individuals, used the appropriate protective equipment, and really been collaborative in their response and wanting to make sure they're doing absolutely the best job they can in keeping their residents and their community safe. The Ukiah Co-op has done a very similar, amazing job in their response, partnering to identify those close contacts. They've helped us in connecting with individuals to keeping the community safe. They had a professional deep cleaner come in to sanitize and clean the entire store. They closed by their own decision to, again, ensure the safety of the community and make sure that they had done a thorough response and have been supported, as CEO Angela referenced, through our environmental health and safety measures, and did a complete walkthrough with them yesterday, and they have implemented some very new practices that will help ensure the social distancing and safety of their employees and the public as they go through. So they are working very diligently on that effort. We had Limber Dentistry over in Fort Bragg that we've also worked very closely with in, again, identifying any of those close contacts, making sure that people are in quarantine, and his own efforts in making sure that his customers and clients are supported. And so the last one was with Ardzoni Vineyards. They have also been a tremendous partner in supporting, not only did they support all of their staff in going to surveillance testing, which is where the positives were identified through that testing. They have continued to partner with us in identifying close contacts and ensuring that their staff are getting outbreak testing. We have partnered with Anderson Valley Health Clinic for that outbreak testing over in Anderson Valley, and they have done, they initiated and did some of the testing yesterday specifically for the vineyard and their staff, and are continuing outbreak testing on Thursday for their community over in Anderson Valley, as well as any additional family members of the staff that want to come and get tested. We partnered this weekend with Mendocino Coast Clinic, and they did 187 tests in Fort Bragg in response to those outbreaks to ensure community support and that people can get tested. Both of those outbreak testings, or all of the outbreak testings, are being processed at the Richmond lab. And so our goal there is that not only will we get those results much quicker because they are specifically related to those outbreaks, but that so we can help contain these outbreaks and help keep our community safe and healthy. We continue to partner with the clinics and have had regular meetings with them. The clinics on the coast and up in Laytonville are all doing surveillance testing through the UCSF testing, and that will be continuing through August. We are also working to get them access to the portal. Those test results are returned back through so that they will be able to access those results in real time and when they come back. So that is our goal, to have that up and running by August 1st and help with the gap in notifications to our community as to results. So we are continuing that effort. OptumServe has also been a tremendous resource for us. There has been some challenges in the last week or so in that the number of tests have been at their full capacity, and so we have not been able to have as far or as early available appointments as we would have liked for our community, but I'm thrilled that the community is getting tested. Those appointments are being booked, and we are certainly working to find alternatives for surveillance testing. To that end, we are also partnering, as I've said before, with Consolidated Tribal Health Clinic, and they are offering testing at various sites. We will have additional testing with Consolidated Tribal Health Clinic this Friday at their site, starting at, I believe, at 8:30 in the morning, and it will be, I think, through 11:30. And it will be open to the public to come and get tested. That is surveillance testing, though. And so I just want to be super clear on the difference. It takes a little bit longer to get those results back because it is surveillance. It's not the outbreak testing. So as we continue to work through this effort, we have worked really closely with the hospital and Jason Wells and his team to make sure that we are transitioning individuals and working with them through our MOAC to ensure that we have the needed remdesivir for patients. I know that our MOAC has done a tremendous job in securing those various doses from other counties and partners. But all in all, it's been, I think it's around 50 vials so far that the MOAC has been able to help us secure in partnership with the Adventist Health. And the other partnership that we have engaged in this last couple of weeks has been with Chief Locatelli through the probation, and he has also been our liaison to parole for the early releases from the prisons. And we have been working very closely to ensure that those individuals are in isolation or quarantine, depending on their release status at the time that they re-enter Mendocino County. And so it has been a really great partnership all the way around. And as we continue to respond, we are seeing a significant increase in the number of cases and working very diligently to ensure that we have the number of contact tracers and case investigators that we need. We are entering into an MOU with the state for the requested supports, and we have activated the disaster healthcare volunteers. And as CEO Angela said, they will be there. There's training occurring today. We have a second training on Thursday, so we are working very diligently to ensure that we have the supports that we need. And I really appreciate the support that our Department Operations Center has received specifically from CEO Angelo and her team in the executive office to ensure that we not only have the resources, but we have the ongoing 24/7 supports from their office to get whatever we need and be able to do the work that we're doing. So with that, I will turn it back over to you, Chair Hashak.
Well, thank you. Thank you very much for all you're doing. It's certainly, it's hard to keep up with all that's going on in the county to keep us healthy and deal with all the outbreaks and situations that are going on. So thank you and your team very much. Are there any questions, Supervisor Judy?
Yeah, Becky, so I'm grateful to hear that the disaster worker team is, volunteers are being activated, and I'm sure that the contact tracing in the county is very, very active right now. When we get a request from a group, the county gets a request from a group like, say, Parents and Friends on the Coast that serve a vulnerable population. Is that perhaps one of the things that the disaster workers could do, maybe teamed up with a county employee to just provide maybe some technical assistance to groups like that? Just trying to understand what we could do with these volunteers in the moments in which there's not an outbreak that they need to go assist with.
Supervisor Journey, thank you for that question. I think that there's several things that are occurring at one time in supporting individuals. So we have various places right now. The training is required for the disaster healthcare volunteers for the case investigation and contact tracing. However, we are certainly looking at additional supports that they can provide. As you shared, people that are in isolation and quarantine need support with food and with various other things. And so how we make those supports happen, the disaster healthcare volunteers may be a great resource there. So it's going to depend on each of the volunteers and what scope they're open to. So that's part of it, but also, working with them to find out what their skill sets are and their locations. Some of our volunteers may be in areas where those individuals are not located that need those supports, but they still want to help out. And so there's ways that they can do that as well, be it phone calls and emotional support. So we are certainly working to ensure that we have all of them engaged in our efforts. And I really appreciate your request there. Also, if I may add one other thing that had been previously asked as to the individuals that had tested positive, you wanted to know how many were related to travel, and we've identified 13 of our 207.
All right. Any further
Mr.
questions?
Chair?
Yes, Supervisor Brown.
Thank you very much. And Ms. Emery, could you talk about the DOC and its hours of operation, what occurs if it's closed? I had some individuals that had a hard time getting through and transferred over to the Sheriff's Department, but for the public, can you explain where their calls go when they call in and who's doing what?
Certainly. Thank you for the opportunity to share, Supervisor Brown. We currently have a call center that is open to answer those calls and the calls that come in. It is open Monday through Friday from 8 to 5 a.m. We have call takers that are taking calls and directing them or answering them depending on the level of information that is required within the call. They get a significant number of calls from the community and the public, and I can certainly share at the next report out as to how many calls that we're receiving. After hours, we have partnered with the Sheriff's Department, and I see Sheriff Kendall is on here, and they have been fielding calls, especially for those that are well checks and things that people need as far as immediate responses, and have been a phenomenal partner to us. They also field those calls on the weekends. We are working to set up a call line that will take messages that are of a non-emergency issue so that those calls are not fielded to the Sheriff's Department in that partnership, because we want to ensure that we are not putting too many calls to the Sheriff's Department that should not go there. They have an absolute focus on emergency response and supporting the community and the safety of the community. And so those inquiry calls over the weekends, we are going to be working to set up a voicemail system so that we can contact those individuals back when we're back in operation on Monday through Friday.
Thank you.
Mr. Chair.
Yes, Supervisor McCowan.
Thank you. There's been, obviously a lot of comments about testing, and we have listed on our tracker commercial testing, UCSF, and public health. Could you say a little bit about what tests taken in which location end up in which category? So I assume the Optum tests, what's listed as commercial is primarily Optum. When we list public health, of course, those that would be taken by public health, where do the hospital testing wind up? Which category do those fall into?
Certainly. So for clarification, it's actually focused based on what lab is processing those tests. So if it's a commercial lab, the UCSF lab, or a public health lab. So for example, the county tests and the Richmond lab, the virological disease lab, are all public health labs. So those tests are shown there when we're talking about them. Commercial tests are certainly where you would see the hospital tests, the Optum Serve tests, the Quest Lab tests, the ones that we're working through the clinics that they're getting that are not UCSF. And then, of course, those that are processed by the UCSF lab are in the UCSF tab. So that's a great question. I appreciate that.
I wonder if, we put so much information up and do things get too cluttered, and where can you find it? But maybe a blurb somewhere explaining those details might be helpful. And then I noticed there's quite a disparity between the tests that are pending. So a significantly higher percentage of tests processed in commercial labs are pending versus public health. Is that partly because, and let me ask and see if I'm making the right assumption or not, but potentially those processed in a public health lab are ones that we think there's more urgency to be getting the test results back, like maybe it's processing tests from an outbreak like Sherwood Oaks. What insight can you give us into the differing percentages of pending tests for the different categories?
So what I would say is that the commercial, that we have a significant number of pending in the commercials because that is primarily surveillance testing for Optum Serve, and the number of tests that they have going through their system every day. As we've shared, there is a significant delay in those tests. So we put in our pending numbers, and they continue to grow as we see additional tests that are further and further out in the results. So that's where that one lies. The public health is significantly lower. That is primarily our outbreak testing. And so at this time, and so as I shared, those are processed much quicker. Certainly, I don't want to reflect poorly. The hospital has been a phenomenal partner in processing tests for us. And while they do show in the commercial that 1547 is really reflective of the surveillance testing that we have done, it is not a reflection on any of our clinics or hospital partners. They have worked very diligently to process tests quickly and get those results to us quickly so that we can monitor and track those individuals as well. The UCSF test, again, it's surveillance testing. It has a slower timeline, and so it also is starting to, you'll see those numbers probably creeping up a little bit. I know they're working very diligently to process those tests as quickly as possible. They do have less counties using it, so it's not quite as much a delay as we had back in May with UCSF, but so we are working very closely with all of the labs to try and get those tests timely, and I know that the state has been working with OptumServe. They've added an additional lab in to assist in processing it, so our hope is that that number will go down as well as we continue. But again, it is the surveillance testing that you see the higher number of delays because it's not the priority testing that we're working to ensure that we are addressing the needs of the community more quickly with.
Thank you very much.
Okay.
Mr. Chair?
Yes, Supervisor Brown.
Thank you very much. This one, we talk about the testing. On the statewide call with Cal OES, Dr. Jacobson from California Department of Public Health said all labs, the turnaround on the test should be shortening. I believe they did a big statewide committee to get that better figured out, bring more labs into the mix. And then also, she stated that we have a weekend lag in information going into the state, not our county, but she was surmising the entire state or different areas of the state, and that today we're probably going to see a big surge because of that weekend lag. And I don't know who would want to comment on that, but I did want to report that out.
Okay. Ms. Emery, did you have a comment for that?
Certainly. Supervisor Brown, you're right. There are some challenges in some of the labs in their staffing over the weekends, and so we do get additional tests on, especially towards the beginning of the week. Our team was in over the weekend. We had two different teams. We had staffing going all weekend because we were continuing to get results of positive tests. And so we did have an increased number of people here doing the case investigation and contact tracing, but Mondays have been historically heavier based on the lab availability and the report outs. I think they're processing on the weekends, but it's the clerical support to send those reports through the CalReady system and notify the various counties that is impacting us with those delays. So we do usually see an increase on Mondays.
All right.
One other aspect of that is tests that are being reported today obviously reflect samples that were collected, maybe 2 or 3 or 4 days, maybe 10 days, maybe longer in the past. So there's inevitably a lag time between taking the test sample and actually performing the test and then reporting the results. So that has a tendency to skew the numbers also. I did have one more question regarding the contact tracing, and we know that we're experiencing a significant, disproportionately large number of positive cases among the primarily, I think, monolingual Spanish-speaking community, but the Latinx community in general. And we'll probably hear more about this later. And if you'll be on to respond to it then, maybe we could hold it until then. But the question is, how are we doing in having sufficient contact tracers who are bilingual? Are we managing to keep up with the demand for bilingual contact tracers?
We will. So we do have bilingual contact tracers, but we are certainly seeing a significant increase in the demand for them. We will have additional bilingual contact tracers up and trained and available on the 23rd. And so we are increasing that pool because we do recognize that that is a necessary resource for us, that we don't have all the resources that we need at this time that are trained in the case investigation, contact tracing, and CalConnect. So we are working towards that effort.
Thank you.
Okay, thank you. And thank you for your time this morning. Okay, we'll move on. So Deputy CEO Darcy Antle doesn't have a report this morning. So we'll move on to Sheriff Kendall, John Martyr, and John Burks for code enforcement.
Good morning, Supervisor Haschak, CEO Angelo, members of the board. Currently, we're continuing to contact about a dozen people a day with the focused enforcement or the directed enforcement. We had 84 contacts over a 1 week period, averaging out to about a dozen a day. This doesn't include any contacts on calls for service in the standard patrols that we do. Every stop that we conduct for a vehicle code violation or every call for service that we handle, we also offer education and masks and things like that during those calls if people are without. We continue to see a huge increase in violence with the arsons, drive-by shootings, and several other extremely violent calls that we've been dealing with. This is causing more arrests. Currently, we have 7 in quarantine in our jail. None of them are symptomatic, but it's based on the fact that they came from other counties, state prisons, and other states. 2 of those have been tested. We have 5 on monitoring right now. A lot of the calls that we're receiving, we actually have to, strangely enough, educate the callers. We've been receiving a lot of calls for violations of the masking ordinance and various other things that aren't actually violations. A single person driving in a vehicle with no mask on by himself in the vehicle. A person who's walking outside by himself, not in contact with anyone else. We've had a few calls on family units who are together that turn out to be just actually a family unit. Most of the time it turns out to be people who don't look like each other who are actually in the same family. And so we'll continue on with those as long as we have the ability to do so. The bailiffs that I've been using, we've still got one who's absolutely just been put on that detail. And then we're still kind of supplementing with the deputies in between when we have times between the call for service. Thank you.
Thank you, Sheriff Kendall. We'll go over to John Martyr.
Good morning, Chairman Haschak and Board of Supervisors. This is John Martyr from the Special Investigation Unit. We continue to field calls from the call center, calls for service. The majority of masking violations that we've received have to do with businesses and either employees of the business not masking or customers of the business coming in unmasked. Those have been referred over to Trent Taylor for the unincorporated areas and the various cities for the incorporated areas. I echo Sheriff Kendall's remarks. Some of the calls that we have received are no violations. The people are in a family group, or it's we get out there and the people have already gone, so we were unable to locate that. But we remain available. I'm staffed up Monday through Friday, 7 a.m. till 5 p.m. Responding to calls for service from the call center. And I'm available for any questions if anybody has anything. Thank you very much for your time.
Okay, thank you. And we'll go over to John Burks in code enforcement.
Thank you, Chair, Supervisor, CEO, and community. This is John Burks, acting code enforcement supervisor. Like Chief Martyr said, we've been having an uptick of the business complaints. So currently we have 10 active investigations. 93 of those, or 93 investigations we have gotten to compliance and closed. Most all of the active investigations are businesses. They are working with us. The community's been really good. It's more of an educational approach at this point. Of the total 103 complaints that we've investigated, 20 were inland, 83 were on the coast. Vacation home rental complaints are down at this time, and we have no current notice of violations. And that's pretty much it on our end, unless there's any questions. Thank you.
Okay, thank you. Questions?
I do have one question.
Yeah, I'm going to go through the list. Okay, Supervisor
Certainly.
Brown, do you have any questions?
Well, I just want to make a point to all enforcement. I did go into shop the other day, and actually it was Saturday morning early. But coming home into Potter Valley, I noticed balloons on mailboxes and also at the beginning of a driveway. So that tells me somebody's doing something. And I realize you can't investigate those, but it's just really concerning to me about gatherings, parties, barbecues, you know, that are going beyond families. So I just wanted to make that statement because you do see that happening. Thank you.
Okay. Supervisor McCowan.
Thank you, Mr. Chair. What is the response that we make when we get reports of a gathering either in progress or planned? And I think there are instances when we get notified in advance or while something is occurring. Have we been able to effectively respond and shut down some of those gatherings or prevent them?
Is that for the sheriff?
And that could be for anyone.
Well, through the chair. We have some responses regarding those things where we've made phone calls and said, you cannot do this, do not do it. We've had a couple of them where we've had some calls regarding this and then it didn't happen. We have to be extremely careful with the curtilage around a person's home. If we show up and it appears that we are searching for something, we need a search warrant. To enter someone's home, to enter the curtilage around their home, you have to have a search warrant. Probable cause does not get you into somebody's door in the same fashion that it would cause you to be able to stop a car. But we've had contacts like that in the north. I'm certain that we've had some on the coast, and most of it has been good compliance after a phone call.
Okay, thank you. Okay, Supervisor Jurdy.
This might be more for code enforcement or for a special investigation unit. When you're just talking to businesses, just helping them understand the details about how they can post signage about masking, et cetera, do you guys give them any tips? Do you tell them to look on the county website where we have signs that they can download, print and put it in their door? Just wondering what that process is like when you do visit the store. I've heard positive comments from store owners about various county employees coming in and being helpful. So I just thought I'd like to hear what that process is like.
Thank you. This is John Burks from Code Enforcement. Through the chair, please. So we have a standard information packet that we compile prior to making contact. Typically, we'll try to reach out by phone, and then we'll also do an on-site investigation and provide as much information as we possibly can, which is what we find is usually kind of where the hang-up is. And business owners are really responsive, especially when they're holding the information in their hand. We also do refer them to the website. We're available to take, their questions. And of course, we always give them the number to the DOC, which helps us, answer and field some of the questions, depending on the appropriate party that would be, responding to them. So we've had a lot of success with that approach so far. Thank you.
And Supervisor Williams.
No questions.
Okay, and I'd just like to say again that with this program that the Chamber of Commerces are starting with the Mask Up Mendocino, I think that would be very helpful to have local business owners working with local business owners and get some of our law enforcement and code enforcement out of that game if we can as much as possible. It seems like that's a better, bang for the buck.
Chair Haschak, this is CEO Angelo. May I ask a question?
Yes.
Thank you. I wanted to go back to something John Martyr said. I think that given the questions of this board, it's very clear that some of the gatherings, whether they're parties or just family functions, small or large, do happen on the weekends. And if I heard Mr. Martyr right, he did say he's fully staffed Monday through Friday, 8 to 5. I'm well aware of calling Mr. Martyr to work on holidays and on the weekends. So I wanted clarification. I don't think, and I certainly wouldn't want just the deputies out on the weekends. I mean, this is, if we're talking enforcement, we need to make sure that we have our enforcement staff out there. So John, if I could just ask you, could you clarify? I know I've called you to work on the weekends, to have a team out there, whether it was 4th of July or just a weekend. So could you clarify, is SIU working on the weekends? Are you absolutely just Monday through Friday? What is SIU doing? Because you are a critical arm of enforcement. Thank you.
Thank you, CEO Angelo. Through the chair, this is John Martyr again. We are currently just Monday through Friday. In the past, we have been available on the weekends, and there was some contractual issues that we have to work out and some scheduling issues with our staffing to be able to cover on the weekend. So I'm attempting to come up with some alternate availabilities for our staff on the weekend and continue to work through those problems.
Chair Haschak.
Yes, Supervisor Williams.
So I've heard that there's a series of parties that have been happening. I think the city of Ukiah shut it down within city limits, and perhaps it's moved to a venue outside of city limits in the unincorporated with 100 people, live band, dancing. I've heard no facial coverings. Not the sort of activity you want during a pandemic. This is happening on the weekend. Who should we call? I understand that law enforcement has a lot of crime to attend to. I don't know that this is really for the sheriff, but who do we call on a Saturday?
Chair Haschak, this is John Martyr again. It's my understanding that the call center, although closed on the weekends, is forwarding their number to the sheriff's dispatch, and the sheriff's dispatch will either send that out to patrol or get a hold of an SIU investigator that would be working.
And maybe we could hear from the sheriff. Is that process working, or do we need to tune it?
I think it needs some tuning, or excuse me, through the chair. I think it needs some tuning. A weekend like we had last weekend where I had to pull every available unit that I had into Covelo, and we'll continue to keep those units in Covelo until I can get things worked out in there. Yeah, it can be forwarded over to the sheriff's office and it brings down into our dispatch center. But if we don't have anyone to handle those calls will continue on. And I think that there are some very easy, quick steps that could be taken to shut some of these things down before they become an issue. However, that would peel some of my people off of some of these crimes that we can't step away from at this point. There's just too much public safety risk on that.
All right.
Chair Haschak.
Thank you. Yes.
CEO Angelo mentioned in her initial update that Mr. Martyr would be contracting with, outside entity of some sort to provide assistance for enforcement with people who are not abiding by the isolation and quarantine orders. Is it possible that the duties of that contractor could be expanded to also potentially respond to some of these reports of gatherings that typically will come in either on the weekends or after hours? Is that a realistic option? And maybe if you could, Mr. Martyr, if you could say a little bit about those contracts and, who you'll be contracting with, in not necessarily by name, but what kind of entity is it, and what exactly will we be looking for them to do? Thank you.
Yes. Through the chair, this is John Martyr again. We're entering into a separate contract with one of our existing private security companies to give us security officers to guard people that have been issued an isolation notice and are not willing to stay in their hotel rooms. And so they will be providing that service. That contract will be coming to the board during your next meeting. I've had meetings with the sheriff and CEO Angelo, and it's our opinion that it would not be useful for them to provide additional enforcement. The private security officers don't have any more power than a private citizen, and although they could be authorized to enforce the administrative sections of the public health order, we feel, as we talked about in our meetings, that this could create some additional issues and some liability towards the county should the citizens contacted be uncooperative. So I believe the best enforcement still lies within the county, the sheriff's office when available, SIU, and the code enforcement at this time. And thank you.
All right, thank you.
Chair Hashjack, this is CEO Angelo. My apologies. I would like to ask one more question. I think that we all recognize what a key issue this is, and I know Mr. Martyr does as well. And so I would just say, Mr. Martyr, we can speak offline. If it's an issue, and I know we've talked about this, and this goes, for code enforcement as far as Trent Taylor's department as well. We don't want to continue using deputies if we don't have to. Particularly, I share Sheriff Kendall's concern over the weekend. All of the men that he had to move to Pueblo for the weekend. There's definite challenges. So, Mr. Martyr, if I could ask you to work with Miss Emery, and if we could talk later this week, if you need additional staff, if it's additional resources in SIU, is there a mechanism where we can bring people in? I mean, I agree with you. If the board didn't think that between the sheriff, Trent Taylor, and you, that wasn't the best model for code enforcement, we wouldn't be at that model. But I think it's critical that we have county staff, no matter what level they are, as far as their ability to work, if they have to refer to the sheriff's office or not. But, we need to have staff working on the weekends. So I don't know what happened with SIU. I know that you have been very responsive and have been responsive on the weekend. So this is definitely something that we need to talk about later this week and really try to resolve. So thank you. And thank you, Chair Hashjack, for allowing me to comment on this.
All right, thank you. And we're going to move on to public comment, if that's all right. Let's see, I see there's one two comment calls. So,
and Chair Hashjack, it's fine to come back to it after public comment, but I did have a question regarding for CEO Angelo and her initial presentation, but we can get back to it later. Thank you.
Okay. Are the people who called in for comment on the line?
Yeah, this is Deputy Clerk of the Board Atlas Pearson, and the first on the line is going to be Charles Bradenberg.
Okay.
Howdy, everybody. I'm Charles Brandenburg. I have Didgeridoo Dreamtime Inn on Main Street in Mendocino. Some of you know me. Howdy, Sheriff Kendall. So I wanted to say that we need to close down tourism, at least for a while. When the stay in place was lifted or perceived to be lifted, everything surged. It was incredible watching it. And it's one of the indicators is how many Latinos are coming down with this virus. They serve these people the most. Those girls clean those rooms. So there's a couple things I wanted to say, though. First of all, something I heard today that Becky Emery said was that 13 of 207 are from tourism. 95 of those 207 are still unknown. They're in that category, so it's 13 of the 112. Then I wanted to say something about respond to something Dr. Duhan had said at the town hall meeting, that 75% of our income is from tourism. It is not. Maybe before the fires, before the Camp Fire, 50% of our income on the coast was from tourism. Then the fires happened and the power shut off. Truly 30%, if that, was from tourism after that. And then I wanted to respond to something that Ted had said online, because he does, get online on Facebook. I've been booted off that site because of how I feel about tourism, so I was booted off. But Ted brought up to someone that wanted us to close, like most people in this village do, that how long do we close for? For years? No, we don't close for years, but we don't stay open when it's on this drastic rise. That's ridiculous. And it's all about the economics, because if it wasn't, we wouldn't have tourists here at all. That's the only reason I have tourists come here, is for money. And now I don't want that money. I want my community to be safe. So it's kind of like this. To open, stay open, or to close, they're both a gamble. But one of them is gambling with money, and that's my money, it's your money, it's our money. The other is gambling with lives. And I don't think that you guys should be gambling with lives at this time. So what I would ask for is close until at least the Congress decides what they're going to do with unemployment. And then decide where we go from there. But do not be stuck in a box where we end up having so many deaths. And we all see it happening. And it is from a tourist. Go to Safeway Market in Fort Bragg. My wife is so uncomfortable there now. All but. Anyways, do the best job you can, guys. Nothing personal against anybody. And Sheriff Kendall, truly, I think you're doing a great job. Have a great day, everyone.
Okay, thank you. Is Ron Stark on the line?
Yes, he is.
Yes, I am.
Okay, good morning.
Good morning. Let's see. I want to make one quick comment about the situation with John Martyr and enforcement. An idea would be for him to work Wednesday through Sunday instead of Monday through Friday, which would enable him to deal with an influx of people on the weekends, parties, etc. So that's one comment I had. The other issue I wanted to bring up is along the lines of tourism. I operate a vacation rental and in Albion, and I'm in conflict about operating that vacation rental because of the impact that tourists have on our county. A friend of mine has a vacation rental in Mendocino who recently had a group of guests, and both of us are in strict compliance with the county health orders of one family unit allowed at any one time. So on her rental, she had a family unit there, and all of a sudden a bunch of cars pulled up. People jumped out, kids other adults, and it was, quote, a gathering. So she ran them off, told them they had to leave immediately. And so this is one instance in, I think, 600 vacation rentals in the county, one instance right there of a gathering. And I would say that vacation rentals are a meeting place for people that know each other. And that kind of incident is happening a lot, and that's just vacation rentals. I know that there is a very strong consensus on the coast, especially seeing as the coast is a destination point, that the tourism is out of control. I mean, there's been reports of people parking their RVs on the streets of Fort Bragg because there's no place to camp, and camping right there, and then getting written up by the police for illegal camping. There's the private campgrounds seem to be completely out of control. I don't think we're really dealing with the issue of protecting our county. I think Governor Cuomo recently in New York was asked what his main concern was at the current time, and he said reinfection of our state from outside. Now that's a state issue, but you could apply that to our county. And we haven't even suppressed the curve. We're in an exponential growth right now, and we're opening everything up wide to anybody that wants to come here. So I would advocate to ultimately shut down tourism, to close down lodging. Now, I know that has economic ramifications, and I know that I've been a part of the lodging group, and I know that people have tried very hard to comply, and I think that's commendable. And in lieu of something like that, a drastic shutdown, quite frankly, I was surprised when Dr.
Your time is up, caller.
Okay, thank you, Mr. Stark. Okay, sorry about that cutoff, but time was up. So Supervisor McCowan, you had a question.
Yes, thank you, Mr. Chair. So obviously, we're all very concerned about the watch list issue, and I appreciate CEO Angelo giving some background on the thinking there. I was very aware of the intention behind Dr. Doohan's order issued on the 17th, but effective the 24th, and it clearly is an effort to get ahead of the state, stay ahead of the state, and forestall being placed on the watch list. So that is absolutely a great move on Dr. Doohan's part. I'll note also, many people may have seen this already, but Governor Newsom yesterday issued a new directive that would allow hair salons, nail salons, and a number of other personal care businesses to operate outside. They are prohibited by their state licensing boards from doing so. However, the governor engaged in extensive discussions with those boards to fully understand their concerns. And again, yesterday issued an updated order that will allow salons and some other personal care services to operate outdoors with restrictions. And you can go to the state website for more information on that. However, we're in this situation where we are still at risk for being placed on the watch list. And as I mentioned earlier in my comments to Jason Wells, I believe our triggers, which were written into the attestation document, which was approved May 18th, related more to what our current experience at that time was with COVID, when we had very few cases. So the triggers were related to percentage increases of what we were already experiencing. And as we've heard from Jason Wells, both at the town hall with Congressman Huffman and today, the hospital has ample capacity to treat all current COVID patients, existing hospital patients, and still has significant capacity to handle further COVID patients. And with all that in mind, and we did have discussion of this last week, I would hope the board would be fully supportive of staff making an effort to intercede with the state to revise the triggers that are contained in the attestation document and connect them more directly to the capacity of our healthcare system. 4 of the triggers have directly to do with how many people are hospitalized, how many in ICU, the very types of factors addressed by Jason Wells. Those 4 are 4 of the 6 key events that the state looks at. So again, I think there's a great opportunity here to take the breathing room that Dr. Duhan has given us to work with the state to revise those triggers, again, to make them more directly comparable to our healthcare system capacity rather than to the very low numbers of COVID cases that we had 2 months ago. So I hope the board could have a little bit of discussion about that. Thank you.
All right, so since this is a time for discussion amongst the board, any motions or actions, is there any discussion about that, what Supervisor McCowan was saying?
I guess it makes sense. I'd like to know, has county staff been in communication with the state, and do they have any idea of how likely the state is to accept an amendment to the county's attestation plan?
And that's probably a question for the CEO.
Chair Haschak, thank you for the question. I think it's very, very reasonable what Supervisor McCowan is suggesting. I personally have not talked with the state recently about the attestation. I would refer, I don't want to throw this one at County Counsel Curtis. He may have more information, and Dr. Duhan might be on the call again, I'm not sure. But maybe County Counsel Curtis may want to or have some insight in this. Thank you.
Okay, County Counsel.
Thank you, Mr. Chair. So I don't have specific knowledge as to whether the state has been receptive to modifications of attestation documents afterwards. And frankly, that's something we'd have to look into. I do just want to make the board aware that the way the attestation was structured, there were multiple parties that had to come to the table to provide different pieces of it. Some of it had to be drafted specifically by the health officer, based on the health officer's judgment. Some of it had to be submitted externally by the hospitals, conveying what it was that they had, what their ability was, and part of it was a letter of support from the board. So I just want to warn the board off the top of my head. I don't know exactly where that falls. That may have been something that was specifically in the health officer's discretion. I don't know how much it might have been based on the ability of the hospitals, the specific details that we're reporting in terms of what they were and were not able to do. So it might be something that would be dependent upon various other parts. I just want to be careful not to get too far ahead of ourselves in looking at this.
Okay, and Dr. Duhan, are you on the line?
Can you hear me?
Yes.
Hello. Hi.
Good morning.
Good morning. My understanding in my conversations with the state is the attestation was a point in time. We all know that everything has rapidly evolved from that point in time all across the state of California. So I've not heard of any county redoing their attestation, as it was a accurate depiction at that point in time historically. And we've moved forward from that. Much has changed at the level of the state from that point. So again, I've not heard of that being done by any county. We could certainly inquire, but I don't believe that's something that the state would be entertaining at this time, are changes to the historical attestation document.
Okay, thank you. All right.
Mr. Chair, if I may.
Yes.
Well, I'm not proposing to change the historic document. It is what it is, but I believe I've accurately characterized it, that the triggers that were written into the original document relate more to what our experience was with COVID at that time. For instance, average daily cases at that time were 1.6, and the triggers were if it increased to 3 or to 5. And of course, we're beyond that point now, at least for the last week or so. But so those triggers relate to how many cases we had at that time. They don't relate directly to the capacity of the healthcare system. And we've heard clearly from Jason Wells that our healthcare system is currently very well able to handle the current level of cases and more. So in terms of what the state may or may not say, a guiding principle here should be nothing ventured, nothing gained. We know that we can handle greater numbers of cases than we've indicated in this attestation document. I don't see the harm in having staff work with Dr. Duhan to make a very respectful, fact-based request to the state that would have the full support of Jason Wells, as he indicated earlier. I don't know why we wouldn't do this. We have this grave concern about being on the watch list and what that would mean for Mendocino County. And here is an opportunity to address the somewhat artificial factors that would throw us onto the watch list. So I certainly hope we will go in this direction. I would hope it would be a consensus position. Thank you.
Dr. Duhan, I have a quick follow-up to that. Do you feel like the state is looking at those historic numbers that we put in, or are they revising and dealing with what's happening right now? So, because
thank you for that question. Yeah, thank you for that question. My understanding, and I was on a call with the Association of Bay Area Health Officers yesterday where this came up, is that the state is not looking at these attestations individually to determine whether a county is on the watch list. There's data that's being analyzed at the level of the state that is it's like an algorithm that then highlights which counties are going to be going onto the watch list. So from my understanding of it, and again, I've been in practically daily communication with the state because of our situation, including a SNF outbreak, which is so alarming. And may I add that the SNF itself is doing an exceptional job of responding, but this has hit across our nation. Skilled nursing facility outbreaks are one of the hallmarks of this pandemic. But because of that, I've been in touch with the state regularly. And my understanding is it's an algorithm that is independent from our attestation. The attestation allowed us at that point in time to become a variance county. By becoming a variance county, we were afforded certain abilities to open certain sectors. And then the governor responded by shutting down certain sectors across the state. But the watch list, as I understand it, is independent. It comes from data that is generated a lot by the hospitals. The reporting of number of cases in the hospital, number of deaths, number of new cases. So I do not believe it's tied to the attestation. I've not heard of any health officers redoing or modifying their attestations because I don't believe that is tied to the watch list at this point.
Okay, thank you.
Mr. Chair?
Yes, Supervisor McCowan.
Well, I have a question of Dr. Dunhan. If the potential to be on the watch list is not tied to the triggers in the attestation document, then why would Mendocino County be at risk given all of the affirmative statements of Jason Wells of the readiness of the healthcare system to deal with all the COVID cases we're handling and projected to have through August 18th?
I would have to get back with you with more information specifically about the algorithm that the state is using for the watch list, but I can tell you that what we're undergoing right now is that exponential rise. So we went from 100 to 200 cases in 12 days. And that means that many of those cases are new, actively in isolation. We would anticipate doubling again. Our doubling rate is about 11 to 12 days from 200 to 400. So that by mid-August, we'll be at 400. We're seeing 10%, as Mr. Wells said, hospitalized, so we just have to look at the doubling rate. And as Mr. Wells said, he's referred to this data that if we stay where we are, we hold the course, we might have, I think he said 21 versus 130. I believe these numbers were referring to people in the hospital. So again, what we're doing, the way we're holding the course now is keeping our numbers at about an 11 to 12 day doubling rate. So you can't look at what we're seeing today. And of course, our testing data is about 10 days behind because we're not getting those results. So we're just anticipating where this is going. If we have 400 cases in 12 days, then 800 in 12 days more, this is what we're looking at.
Again, based on the most recent projections, and Jason Wells referred to the work that Stanford is doing, that says that we would have 21 hospitalizations by mid-August, I believe, well able to accommodate it, and abundant capacity beyond that if, in fact, we do go into the doubling rate that you're describing.
We're in the doubling rate that I'm describing. That's our current data. And he said that would be, not he, but what the data is that if we hold the course where we are now, we will have 21. If we do not, then we will be at overwhelming surge capacity. So the message is hold the course where we are now. Hold the line.
Correct. Hold the course, which means those businesses that are currently open, we hope to be able to keep them open, not open any further. No one's suggesting that in any way whatsoever. But yes, that was predicated on if we hold the course. So we're doing that. So again, here's what I would very much appreciate. If you would check with the state and see if there is any connection whatsoever between the triggers in the attestation document and the watch list. Because I'm having trouble grasping the idea that the state wanted us to comment on 11 specific triggers and set thresholds, and then nobody's considering that data when they're making the very critical decision of whether to put a county on the watch list or not. And if those triggers do bear relevance to being on the watch list, given that they related to our experience with COVID 2 months ago and not to the capacity of the healthcare system, I would hope that we would make that clear to the state and advocate that any decision to put us on the watch list be related to our healthcare system capacity, because that's the critical factor.
Okay, point understood. Yes. All right, any further comments on that?
Hashtag, This is CEO Angelo. There was one question that did not get answered, and it may not be able to be answered today, but I would like to put it out there so Ms. Emery could get back to the board. And that had to do with our new cases, the last 13 cases, that were any of those cases connected to travel within Mendocino County or people that work in the travel industry, whether it's hotels, restaurants, whatever. And I don't expect Ms. Emery to be able to answer that question right now, but it was a question that came up, and I think that in the near future, if Ms. Emery could answer that question, that would be good. So thank you.
Okay, and we do need to take a break.
Chair Haschak.
Chair Haschak, I have
Supervisor
just
Williams.
one more, if I
Supervisor
may,
Williams.
quick one.
Supervisor Williams.
The CEO brought up the SIU schedule, and I think the sheriff agreed that we need some tuning. Do we plan to leave with any action today? Any direction on this?
I know that you're not asking me, but I obviously want to jump in. I have been conferring, of course, with Ms. Emery and Tammy Moss Chandler, and we will meet with Mr. Martir. And I want to say this, that when I call John and ask him to get somebody out on the weekends, he's gotten staff out on the weekends. So, you know, this is, I think, new information for all of us. So we could come back at the next board meeting, or certainly within this week, send the board an email as to a follow-up. You know, I believe there needs to be a follow-up. We can't have just deputies out on the weekend. So thank you.
Thank you.
Okay, Supervisor McCowan. Any further comment from the board on that? Well,
hello. There's consistent reports that a tourist who stayed on the coast tested positive. I would assume that our public health is well aware of that and responded to that incident. Is there a brief update on that situation? Was it verified, and what action was taken? Thank you.
Ms. Emery.
If I may, through the chair, thank you, Chair Haschak. I can tell you that we have investigated all reports that have come to us of positive individuals, and have put individuals, as we're aware, into isolation or quarantine based on their contacts. And so I hope that answers the question that you have.
The initials of the lodging facility would have been HH.
So I don't know that I can discuss specifically without having, I can't release any information prior to getting more information as far as how many positives with any one lodging and what that determinants are under CDC guidance for outbreaks. And so at this time, I can just say that all the reports that we have received, we have investigated.
Hey,
thank you.
All right.
I actually have one more question for CEO Angelo. I see that there are $17 billion in grants, 100 plus wide-ranging grants that potentially we would be eligible for. Numerous state agencies, in collaboration with the California State Library, have consolidated their grant and loan opportunities into a centralized portal. It's a challenge for us, I know, to cover all the bases, but have we assigned, or could we assign someone, or even hire someone to investigate which of these 17 billion in grants might Mendocino County be eligible for? What do we need to do to apply? It seems like it's a great opportunity to bring some resources into the county. Thank you. And I understand on short notice, maybe there's not a quick answer, but certainly at our next meeting, I would hope that someone would have looked into it and we have a plan on how we can review these grant opportunities to see what might be achievable for Mendocino County. Thank you.
Chair Haschek, I can answer that question. Deputy CEO Darcy Antle has actually been working with this under disaster recovery, and we have hired a contractor to assist us, and we certainly could give an update to this board at the next meeting. So thank you.
Okay, thank you.
Thank you.
I'd just like to bring up one thing. We do need to go to a break. Why don't we go to a break, and then I'll bring up my last thing, since we're at about at the end of this topic. So let's take a break until 11:28, and we'll be back. All right. 11:31. All right. So as I was saying, I have an item that is of concern with the COVID. Because our staff is so overwhelmed right now with dealing with all the outbreaks and myriad of issues going on, that normally that the board can ask up to 4 hours of staff time for an issue. And I think that in light of this pandemic, we need as a board to really cut back that time that we're requesting of staff for any kind of personal business. If it's an issue that it's a board directive, certainly that time should be given and we should go with it. But if it's an individual supervisor, I think that we should cut down that time unless there is a majority vote of the supervisors to move in that direction. So I was thinking if we could cut it down to an hour, that would be very good in this time of pandemic response. Any comments about that proposal? And if it
so moved, Mr. Chair. And again, that would be 1 hour of staff time devoted to any particular issue without majority board approval.
Yeah, and that would be, it could cover a broad thing. I don't want, okay, do this and then do that and add up the hours, stacking the hours as could be. So I think the intent is really to not have individual supervisors kind of dominate staff time.
I fully agree. And I don't believe that I've been doing that. I make very few requests. I think we're all mindful of the issue. I have no issue at all saying that we are allowed a maximum of an hour of staff time per issue. If you want to make it per week, I could go along with that.
Yeah, that might be a way of dealing with it.
Chair Haschak?
Yeah, Supervisor Williams.
Could we hear from staff about how it's been going? I mean, I always wonder, am I asking for too much? I don't know if we're talking about me here.
Great question. Let's ask CEO Angelo if she has any comments about this.
Well, thank you, Chair Haschak. I appreciate the action of the board. I think that I would take this as a board directive. My interpretation of this might be a little different than some of yours, so it would be good to have clarification. We do find ourselves getting requests that interrupt the day, and there's a difference between interrupting the day with a board request and a request that may not be pertinent to the situation that we're in. There are times that we do have to pull ourselves away from priorities of the board to answer some specific questions or to do duplicate work, when in fact, if a board member could just wait, they could see that this information was coming forward to the board anyway. So I think that this is timely, just like every place else in this county and every other county. I'm losing good staff. The county is losing good staff. Some of that is just because for certain people, it's just time to go. And for others, it's a really stressful time. And there's not one of us that needs the stress. And that includes the board. So I think that to say that there will be limited requests for information or actions that have not been a known board priority and have nothing to do with our pandemic would be pertinent in that directive, along with what I'm hearing is that should a board member have an urgent issue and they would like assistance, that it would be 1 hour in total from all the staff that are involved. We had some duplicate work that had to be done yesterday. It took 3 of us. That was at a minimum 3 hours, and it was unnecessary. So, my hope is that we could limit this to those known priorities of the full board, to the COVID experience, and that it would be 1 hour in total for all the staff that are involved. And that would be not a direction that we must do this, but that would be the parameters for a request that would come in. And again, we've said this before, that everybody has a job. Everybody's doing their job. The board is, the staff is, everyone. And then we have the board directives. The directives are understandable, but they come every Tuesday. And it's understandable as things come up where the organization is dynamic. But it's when those individual requests, because one person wants information, cannot wait for everybody else. And that's what becomes what I would say truly is unnecessary and creates duplicate and unnecessary work for the staff. So thank you.
Okay, thank you for that clarification. And if the board so goes with this directive, then I hope that we could get an update. At least I, as the chair, could get an update about how things are going with staff. Okay.
Certainly, thank you.
If I could just ask a clarifying question. The board sort of mentions the exception there for board directives. I think I'm understanding that as directives that essentially have been given since the COVID. There may be things that the board had directed before the emergency that have been sort of on hold, and I would understand those to sort of still be potentially on the back burner unless the board indicates otherwise. I just want to confirm that that's correct understanding.
Yeah, that sounds fine with me, because certainly we have new priorities with COVID.
Mr. Chair.
Supervisor Brown.
Thank you. I just want to make a statement for a lot of constituents. Yes, we are in this COVID emergency. They all apologize. But when constituents come to a county supervisor and ask for information or perhaps statements from a county supervisor, sometimes it's necessary to go to staff. I try to limit that because I'm very aware of the hours that they're working on COVID and the hours that they're working on other issues. But I do have a concern when I do need to go to county council. It could be on an email that you were sent asking for statement or a call back. Many times I feel I have to go to county council and or the office and ask the question, is this appropriate? So, and it's with other issues as well. So I hope I'm not one of the individuals that's taking all this time, but there are times when I have to go to county staff. Thank you.
Hey, thank you. So overall,
Chair Haschak.
Yeah,
well, another wrinkle to that. So, and I think Supervisor Brown was emphasizing COVID-related calls from constituents, or it could be other issues that are perplexing to them. I did get a call yesterday of concern from someone related to a census training and her concerns over, was it going to be in compliance with our guidelines? I followed up with the census officials to get additional information. I think it would be appropriate for me to send that information along to staff for them to verify that this training, which could involve a fair number of people, is being done in a way that is compliant with the social distancing guidelines in order to assure everyone's safety. So, I think there does need to be some flexibility, but in terms of asking staff to actually do things, I think it's completely reasonable to have limits on that. I will say there are some agenda items that I think could easily be consent items that I would like to send forward. And staff obviously, when they get an item, if it's determined, yes, this is appropriate to include on an agenda, they do need to do work around that agenda item. We heard a request this morning from various members of the Tobacco Coalition, and you and I, in fact, at one point went on forecasting to have an item related to vaping and a lot of the other issues that they're discussing. You did work with the group, found out, they had been working on it even before COVID. They were struggling to get it on an agenda. The business of the county can't stop while we continue to deal with the pandemic, which is likely to go on for the foreseeable future. I haven't heard anyone credibly predict an end date for the COVID response. That item brought forward this morning in my world, if it showed up on consent, that'd be fine. Potentially, that's a way to move things forward that may be controversial to some, but do further the overall public health and welfare. We could be a little bolder on some of the items that are included on consent. I guess I hear all the concerns. I appreciate you bringing the issue forward. We have to find a way to still keep county business moving, even in these very challenging times.
Yeah, I agree. And I am looking forward to talking with County Council to see what kind of work that bringing the vaping would entail. But the issue at hand is our as supervisors, demands on staff time for individual concerns. And are we in agreement that we should have a directive to staff that we will limit that?
Chair Hashtag?
Yeah.
I would like to read the directive back into the record and see if I have it correct, please.
Yes, please.
General consensus of the board to limit the amount of staff time to 1 hour per week, cumulative for all staff involved, as requested by any individual board member.
Okay, are we good with that? Supervisor Jurdy? That's a yes?
Yes, thank you.
Okay, Supervisor Williams?
Yes, I can support it. I would like to know from staff what would have been trimmed over the past week or the past month had we had this in place, just to get a sense of where we may slow down, but I support it.
Staff, do you have any comment to that?
We could submit a list to you, Chair Hashtag.
All right, thank you. Okay, Supervisor Brown.
Thank you, sir. And I'd like to see the list, so I hope it's to the full board. Thank you.
Okay, and Supervisor McCowan.
Yes, I will note we have those situations where we have numerous ad hoc committees. Some of those ad hoc committees actually do need to meet with staff, perhaps multiple staff members, to further the work that they're charged with dealing with. So again, I do fully support this. I think there needs to be some flexibility as well. And I think the directive pertains mainly to clerk of the board and executive office staff, or is this intended to be all staff countywide?
Well, I think it's staff countywide. And if there's something that is extraordinary, then it needs to come back to the board.
Well, if it's staff countywide, that's going to prevent us from doing a lot of our work.
Well, the ad hoc is work can proceed. That's certainly been set up and approved by the board already, so.
I think it's perfectly reasonable to have this apply to executive office and clerk of the board staff. I think it's an overreach to say that we couldn't contact Department of Transportation around an issue that may come up. As Supervisor Brown mentioned, there's numerous instances where our constituents reach out to us and they want to know either what's going on with a particular situation, or they're bringing a situation to our attention that we then need to pass on to the appropriate department. So again, I think there has to be some flexibility here.
Chair Haschak, this is CEO Angelo. We could delineate this as those staff or departments that are responding as disaster service workers in the COVID experience. We could also include going forward, since we are not only working on COVID right now, but as the Sheriff's Office knows, under Shannon Barney's leadership, we are preparing for public safety power shutoff, and obviously there's fire season. So while we're dealing with COVID, which we don't see going away for the next 12 months, I think if we could say those departments or those employees that are functioning in their role as disaster service worker, that those would be the departments and the employees that would be subject to this directive.
Very good. Are we all right with that?
Mr. Chair.
Yes. County Council.
Thank you, Mr. Chair. I'd just like to comment a little bit on that. I would say even if the departments not dealing with COVID are exempted, I would still ask that the board could still be kind of mindful and careful there. I will note that my department in particular, a lot of things that are initially directed to other departments end up taking some of our time, because we're asked to do work or research related to a request that's coming from a particular supervisor. And there's a lot of sort of collateral impacts that may not be immediately obvious. So even if they're exempted, I just ask the board to be sort of careful and mindful of the fact that the request might have a broader impact. And then I'd also just note, I believe, as I'm understanding this, and I'm sort of seeing the way this would work as a practical matter, I think there would be a pretty significant distinction between where the board is acting sort of as a conduit for information or complaints that are coming in from the constituents, members of the county, and referring them to proper channels, versus the sort of work that may go into, say, a request to meet with the supervisor, explain the details related to a particular issue, brainstorm possible solutions. The issues related, particularly to things like enforcement issues, questions about interpretation of the order, I think are going to need to be sort of legitimately channeled into the appropriate departments to be able to address them. Where I see a potential efficiency issue is the degree to which staff time gets taken up, then not just in sort of receiving and acting on the information, but to the extent that there's a lot of additional information or additional work that may be requested by a supervisor as part of that.
All right. So do we have a general agreement that will go with this policy?
Yes.
Okay. Seems like we do have consensus on this. So thank you all. And I hope that helps staff deal with situations in the future and get through this pandemic wholly and healthily. Okay, moving on to the CEO's report, item 5B. CEO Angelo.
Thank you, Chair Haschak. This is the first time in any history that I could remember that there have actually been comments and questions from the public about the CEO report. I would ask, in light of the fact that it's 10 to 12 and we have a full session in closed session at noontime, that I go through my CEO report, but that I do not focus on the planning director's component, and that we hold that for either after lunch or anytime this board chooses. There's no way we can get through this with all of the comments from the public within the next 10 minutes, and we have a time certain item at noon. So if it pleases the board, I would go through my report. That should bring us right up to just under 12. And then if we could go to closed session and do Brent Schultz's component of my report after lunch.
Okay, that sounds fine. I didn't know that there was a time certain, 12 o'clock. So with that, I certainly agree with what you're proposing.
Thank you. Okay, the CEO report starts out with the human resources update, which focuses on COVID-19 response and the statistics. And for this board, you could see the leave update of our employees, those employees who have taken emergency leave. At this point in time, the numbers, and of course, the numbers of those employees that are off for childcare and then advanced sick leave. And I think what's important here is that Human Resources has been monitoring this weekly. And one, it's important for us to know the impact to the county system in general from COVID with our employees having to have time off. And then also it speaks to giving us a bird's eye view of those employees that could possibly need our help. So I think this is a good report, and I appreciate Human Resources looking at this. Additionally, we have had some challenges, just as everybody else right now globally that has been impacted by this pandemic. It has trickled all the way down to Mendocino County and our employees. We have had a record number of employees who, have been off for sick leave, have had child care issues, but also have just had some general anxiety, some general depression, some real issues that are situational to where we are today. So we are taking a look at that closer. And actually, I will be working with Dr. Janine Miller and Tammy Moss Chandler, looking at that to see what we can do as a county organization to assist our staff during this period of time. Again, we hear these stories. We hear these stories about our staff. We see the needs that they have. And that's why you see some of the questions, comments, and requests that come forward from staff, because we recognize we have 1,200 staff, every single one of them, just like the 5 board members. We are all impacted by the situation we're in. Those staff that have financial problems before pandemic, the staff that are now a 1-family income instead of a 2-family because of this, those that have children that they are closely watching and taking care of because they're at home and not in school. There are multiple issues that our employees are dealing with, and we're here to help them. So we continue to gather information from Human Resources, and we will be working collectively with behavioral health to see what other services we could provide to our staff. There's also a vacancy list attached, just as there has been for every CEO report. And then, of course, all of our working on wellness, which you can see on page 2. Page 3 is an information services update. I'm not going to go through that. It's quite in-depth during this week, and you can see there's still a lot of work being done with our IT department. Health and Human Services provided a written report that is attached to the CEO report. And then on page 4, we also have our request for proposal update, and you could see those proposals that are out for bid right now. And this is actually a short list compared to what we usually have. On page 5, there's a brief paragraph from Planning and Building on the Cannabis update from them, and that is the bulk of my report this week, which we'll get into a little later. The Cultural Services Agency, as this board knows, we do have some staff changes coming up at the Cultural Services Agency. We are looking at this, and we will be coming forward to this board at some point within the next few months. I can't tell you when right now because it's not a number 1 priority. The museum is closed, as we know, because of COVID, and the libraries have curb service. We have some very good staff in the library, the museum, and the parks, and we are actually drawing on library staff to assist with COVID. The parks, we know we need to do more with the parks. It doesn't matter where parks lands, whether it's a standalone, whether it was with general services, whether it's in the Cultural Services Agency. We have not completed the assessment of the parks. That was because there was no approval on the money for the phase 2 of the assessment. I have asked staff to bring that back to the board at some point. I'm not sure when, maybe in the fall. but I think we really need to look at this. I would like us to seriously look at our parks as economic development. Mendocino County has beautiful parks. We haven't had the money over the last 10 years to put into those parks. It would be good if we could put some additional resources. We know that the purpose of the assessment was that we would have it done so we could apply for additional government funding and grants for these parks. And we haven't been able to fully exercise that and realize any of those additional dollars. So I think we've stopped midstream with the parks. And again, this will be something that comes back to this board. And if we can look at the parks, not only for the enjoyment of Mendocino County residents, but for economic development, I think that other counties are certainly looking at their parks as a method of bringing in tourists, which of course we've already talked about today, that do we really want more tourists in our county? But you know, COVID won't be, as somebody said earlier, COVID may last the next 12 months, but we don't expect it to be here for forever. So at some point when we get back to the business of the county, more so than we are today, these parks may be something we want to look at under the guise of economic development. Page 6 speaks to animal care services. I'm not going to read these, you can read them, but clearly Rich Molinari and his team have done an exemplary job with our shelter, and they continue to do so, and it's evidenced on every CEO report, and also by the fact that we don't get those multiple complaints that we used to get almost daily on the animal shelters. So page 7 speaks to the upcoming board meetings. We have 2 in August, the 4th and 18th, boards and commissions, and you have a position justification report, a vacancy and recruitment update. Tammy Moss Chandler has included her Health and Human Services Agency status report, and we have the list of boards and commissions, and of course, the planning and building information from Brent Schultz. And Mr. Schultz did include a memo, and he also included correspondence that this board wanted to have regarding CDFA and CDFW. So again, his addition to my CEO report is probably 3 times the size of the CEO report. So I expect that the board will have questions and that the public will have questions. So Chair Hashtag, if we could save this piece of the CEO report for after lunch, that would be much appreciated. And going on noon at this point in time, and again, we do have agenda items for closed session, and of course, closed session at noontime. And we have one item that I think will take longer than the others. So Chair Hashtag, I turn it over to you at this point and ask that we could take a few-minute break and then go straight into closed session. And if the clerk could tell us if this is the same number or if we access closed session from a different Zoom account. Thank you.
Okay, so yeah, we'll take like a 7-minute break. But what I wanted to say for those people who were on the line ready to comment for 5B, that, you know, we have a lot of items on the closed session. And so we could reasonably expect, I'm going to try to get this as close to 2 o'clock as possible. So if we end closed session at 1:30, which is what we're supposed to do, then we will fill it in and we will start the public comments as close to 2 o'clock as possible for 5B. All right.
Chair Hashtag.
I hope that clears up things. And Supervisor McCowan.
Thank you. I think many members of the public may have been alerted by some action alerts that were sent out. Many of the people submitting comments and requesting public comment may not be aware the board is not going to be taking any action today on cannabis-related issues. The information submitted as part of the CEO report is informational that will inform our future discussions. But perhaps while we're adjourning to closed session, members of the public who had signed up to speak may reconsider if it would make more sense for them to hold their comments until cannabis is back on the agenda, which I think may be next week. And they'll have every opportunity at that point to address the board on a day when we will actually potentially be able to take action. Thank you.
Okay, and I think hopefully the people understand that we are not taking action today, that this is just the board CEO report. So, but with that,
Mr. Chair,
we have to give people the right to speak. So
Supervisor McCowan, our meeting is not next week. The next one is August 4th.
Yes.
Thank you for the correction.
So with that, we will take let's see, we'll come back at 12:10 in closed session on the closed, on that Zoom.
Chair
conference.
Hashtag, if I may respond, this is Deputy Clerk Lindsay Dunham. I'm just responding to a question about the closed session invitation. It is a separate invitation, and you should have all received it. If you did not, just let me know and we'll resend.
Okay, so just to be clear too, is that we will be back at 1:30, hopefully, and we will take those public comments around 2 o'clock. All right, thank you. and then we had some technical problems. So anyway, reporting out from closed session, we dealt with item 9A, direction was given to staff. 9D, direction was given to staff. And on item 9E, public employee appointment, county health officer, a motion was made by Supervisor Williams, seconded by Supervisor Brown, to offer the position of public health officer to Dr. Andy Corin. And he will start as soon as possible, with certainly the hope of being September 1st being the latest. So we welcome Dr. Corin. He's a local physician, well known in the community of Ukiah, and we think that he'll do a great job. So thank you, and we look forward to working with you. Moving back to item 5B, which was the Chief Executive Officer's report. We have public comment, so we will go to that public comment now. We are going to keep it to 3 minutes. At the 2-minute and 30-second mark, you'll hear a chime, and then you will be cut off at 3 minutes. So please keep your motion or comments succinct. And remember that there is no action being taken on this week. So with that, Deputy Clerk of the Board, do we have people waiting?
Yes, Chair Hashak, this is Atlas Pearson, Deputy Clerk of the Board, and the first caller on the line is Buck Turgis. Okay, thank you.
Hello, I am Buck Turgis. I've been here in this area. Hello, can you hear me?
Yes, go ahead.
Yes. Okay, I've been in this area about 33 years, and I've seen a lot of changes, especially in the past 2 years. The big grow operations out in the rangeland. So my concern essentially is that I would like the regulations to stay in terms of permits to be the same as they are now, but I'd like them to be enforced. I'm afraid if it goes to the state, it will not be enforced well. I'm afraid that perhaps it's only the Highway Patrol is the only one for the state, and I'm not confident. And I think that this is the county knows best and how to really enforce this the best way. So I think it needs to stay with the county. I am interested in amateur astronomy. I noticed that when I observe, I see lights on at night where I am. Before I saw no lights, which is disturbing for our beautiful skies. I see these huge greenhouses, and I'm worried about, I see water trucks coming in, a lot of soil trucks coming in, and I'm afraid that our environment is being deteriorated. I'm afraid for the streams, I'm afraid for just the local habitat not being supported the way it should be. So that is essentially my request, that it stay the same and be enforced.
Supervisor Hashak,
thank you.
May I ask the caller a question?
Sure, of course.
Well,
Chair, is that okay with you?
Well, if we do this, all the callers,
I promise I won't ask each caller, but since just to steer the future callers, I hear a concern of keeping local control or handing it to the state. And yet I haven't seen that item scheduled to come before the board. I don't think that's being discussed. And I've read a lot of the public comment that seems to touch on perhaps some misguided news that's been circulating. What we're looking at is how to complete the California Environmental Quality Act requirements. It has nothing to do with state versus county or keeping regulation versus getting rid of it. It's how do we get through the CEQA process? So I guess I'm curious, is it just misinformation or am I missing something?
Well, my understanding was that it was a discussion of whether it would be a state guidelines or stay in the county guidelines. That was my understanding of what this is about. Now, maybe
Where did you hear that?
Well, from my brother who lives here, discussions that we've had about what this is about. So maybe it's best that you make a statement to all of us to let you know what your position is and what this is about, how you see it.
So Chair Haschak, I wonder if you could give a brief, non-political overview, because we have a lot of comment ahead of us that I feel may be off topic if we're not, if we don't disclose what we're actually attempting to do here.
Yeah, I think in Mr. Turgis's case, he was probably responding to the previous agenda item from a couple of weeks ago about repealing the cannabis ordinance, the local cannabis ordinance. But what we're dealing with now is the report from Planning and Building and their communications, responses and everything with CDFW, CDFA, and how it's going. So, and how to create a CEQA compliant program. So with that, let's continue on, if that's all right with you, Supervisor Williams.
It is, but I still fear, you and I know what that means. The public at large, people who aren't tracking this day to day, may still be lost. And I wonder if there's a way we could frame it so that we don't, otherwise we're going to hear, an hour of public comment that's really not pertinent to the issue at hand. And it's nobody's fault. It's just a complex issue.
Okay, well, with that, let's...
Could I make one more comment that seems to be pertinent? The last comment that I would make is, when permits are issued for marijuana cultivation, instead of the permits just being issued, I would like to see where actually an inspector goes out to see whether people are being compliant and whether what they're doing really makes sense and it's within the county regulations. Because I fear that people are given a go-ahead, cartels are coming in, and it's not really being looked at. And so people are doing what they want to do without really the county knowing what's happening. And the public at large is losing.
Okay, thank you, Mr. Turgis. Okay.
Thank you.
Deputy Clerk, can we go on?
The next caller on the line is Corey Miller.
Hi, Board. Thank you for listening to me. My name is Corey Miller, and I live up in the National Forest, and I came and spoke in February. And my concerns have to do with keeping our local ordinance, because our ordinance has protections for the rangeland and forest land, where the state is just going to open it wide open. And this isn't a good place for agriculture. It's not agriculture when it's 40-yard trucks of dirt and water trucks driving all day long up here. Because of the scale of the growth of the marijuana in illegal areas, and I think that has a lot to do with the staff. I think that the ordinance exists to keep people out, but there's no enforcement up here. And I don't think the state really cares that much about Mendocino County. There's 38 million people in the state, and we have like 110,000. So I think they're not going to do as good of enforcement as our local people who live and participate here. So I can go talk to you, Kyle, or talk to Matt Kendall and have some response, where the state, I can't imagine how that's going to really help. And I think that Matt Kendall really needs a lot of support in Covelo. Like, he's been doing stuff and coming up here and busting these giant grows, 55 hoop house grows. Almost all the grows are illegal, even if they take the permit. And there's another issue, the permit. Like, if I build a house, I have to have the permit first and not, pay the fee and then build the house and then see if I get away with it. And so I think Matt Kendall, we really need to support him and get him more officers, enforcement officers, code people out here to drive around and stop people from doing what they're doing. And the water trucks on these roads are destroying the roads. The big soil trucks driving through are destroying the roads. The generators at night is ruining the quality of life here. the lights that, illuminate the forest now. Like, I own up on the top of the mountain, and when I get up on top of Anthony Peak and I look down, it's lights everywhere now. It used to be dark everywhere now. And I think a reason a lot of people moved here was for the beauty of the county, but we're attracting is like the lowest common denominator, that the greed is ruling Covelo now. And it's really I've never seen it look so bad. I've been here 35 years. And so I think that, the board should not refer to the state on this, and then we should keep our ordinance and keep working on it, and that Matt Kendall needs to be supported, and it would be great if you guys drove out here someday to see what's going on in the National Forest, because it's there's a huge amount of erosion. We don't have a grading ordinance, and so they just put in these grows, and there's huge slides down on the county roads. Then the county has to pick up the fee for all this, and I hope that we can come to some agreement on.
Okay, Deputy Clerk. Did Mr. Miller get cut off?
No, that was his time.
Okay. Next.
The next caller on the line is Hannah Nelson.
Ms. Nelson.
Hi, this is Hannah Nelson. Yeah, hi. Sorry, took me a minute to unmute. Thank you for taking public comment. My comments really are more questions, and particularly surrounding the update regarding both CDFW and CDFA, the Appendix G. And with respect to CDFW, I am wondering if the board has inquired about taking a simultaneous alternative track to amend the local ordinance to simply refer to the need to do sensitive species and habitat reviews without specifying exactly what agency would do it, so that if things fall apart with CDFW or they are continuing to delay in whatever review they conduct in the context of a pilot program, if that even gets worked out in time, that there is a way for qualified professionals, and I am suggesting that we potentially define that in any ordinance amendment change, to require sensitive species reviews be handled by qualified professionals, whether they're biologists or whatever qualifications, and simply not refer to which agency. And that way, we're concentrating on the fact that they need to be done and by the level of professional that needs to do it, and not by which agency. The item with respect to CDFA and the update on Appendix G, I am a little bit, not a little bit, a lot thrown back by the fact that the cannabis program is now stating, or the planning department is now stating, that it would take 11 to 14 hours per file to do Appendix G. And just a short time ago, they were saying only 2 hours per file. And I realized that perhaps the Appendix G was not final by then, but the memo that they attached is from 2019 from CDFA, which outlines what is needed. So it could hardly be a change in the information that they understood would be needed. And, I think that we need to be solution oriented here, where people come together, cultivators and staff together, and figure this out to get everybody through phase one. This is an enormous problem, and all resources should be directed towards it with respect to this subcategory of issues, of course. I think that we need to ask some serious questions and more detail of staff with regards to how they arrived at the specific information that they presented, and particularly with respect to why they believe that a certain number of properties would not make it through the sensitive species review and habitat review, when in fact those.
The caller's time is up.
Hey, Chair Haschak.
Yeah, Supervisor Williams.
So, I support this discussion, but I don't think it's agendized. We're really misusing the CEO's report. I know the board had agreed, let's get this information out for August 4th. Let's attach it to the CEO report. But I think having a board discussion and public expression about an item not clearly on the agenda is questionable. What's your sense?
Well, I had this talk with county council, and people could have talked during public comment, but since this was an agenda item for the CEO's report, and that what we talked about at the last meeting about embedding the planning and building report for the update on the cannabis program within the CEO report, then it was a question of do they do public comment or comment on the CEO's report? And so that's what we're doing. So,
I appreciate that background helps. Can you further clarify, will there be any board direction or action entertained, or is this public expression only with no board?
Yeah, this is just public expression.
Thank you.
Okay. Continuing on, Deputy Clerk, and thank you, Ms. Nelson. Sorry about cut off.
The next caller on the line is Judy Turgis.
Good afternoon.
This is Hi. Hello.
Hi.
The first one is my husband. We've been here, 6 acres wilderness area since '87. Now I'm really concerned about the loss of our wilderness area. We're in the wild and scenic shaded area, the Middle Eel, and I have these farms. We call them gardens, but they're coming up across the canyon from us. Our rangeland really taken apart by this growing. The people are given a permit to build without having looked. And we're also seeing some big coming in.
Ms. Turgis?
Coming in from Asia, so they can, yes.
Your connection is shaky.
Go ahead.
Okay.
Oh, I'm so sorry. I wish we weren't. I'm having a hard time with it. Anyway, I guess you can't hear me.
No,
but I'm just going to say that I'm very concerned that big money is in here, $1 million operations, commercial corporations buying up farms and ranches near us. And wow, it's the nature, character of this area. We're here to be wild and stuff. Now we're in the commercial area. It's growing to the valley, Colo Valley. There are other places where there is agriculture. There is infrastructure. They're trying to have it in the rangeland all year. And I'm really impressed with the supervisor, how much care, time you know every issue. So thank you for hearing, and we'll keep hoping.
Okay, thank you.
The next caller is Robbie Weir.
Mr. Weir.
Hi, guys. Can you hear me?
Good afternoon.
Can you hear me?
Yes.
Okay. Hey, I've lived in Covelo for almost 50 years. Ran a lumber yard here for 30 years. And during the course of that time, being in the lumber business, I ran up against a lot of things in big business that didn't seem to be right. Butted heads with LP constantly. And I had an opportunity in the past to fly over this area numerous times and take a look at what was happening when the forest was treated like an industry and we had rules that weren't being followed. And we had a grading ordinance that we had to fight every year to make sure that it was going to be handled in an equitable way. And A lot of times it wasn't. But now we don't even have that. And I've flown numerous times again, and I have to say that what's happening to the forest and the industrialization of these grows is really terrible. And I don't think that handing it off to the state would be a very good move. I think that we need to keep our regulations local. And I'd hate to see us give that up. That's basically all that I have to say. Thank you.
Okay, thank you, Mr. Weir.
Next on the line is David Drell.
Yes, can you hear me?
Yes, good afternoon.
Good afternoon. I just want to quickly remind the board of what the public had to say in 2016 when Prop 64 was approved and Measure AF, the cannabis industry's dream initiative, was turned down. And Measure AF was opposed in every single district in the county, and the margin and the margin of victory, the margin, and 22,534 people voted against AF. The public did not want to turn Mendocino County into a cannabis Disneyland, even though they approved Prop 64 by 20,000 votes. They didn't want cannabis everywhere. And slowly but surely, the board, working in an unseemly fashion with the cannabis industry, is attempting kind of cynically to meet every need of the cannabis industry. I want to quickly say that Supervisor Williams is completely out of line to suggest that the public doesn't know about this issue. In fact, Supervisor Williams actually doesn't know too much about the issue. And in fact, at the last board meeting, the board foolishly denied themselves any access to the kind of information, direct information from CDFA and CDFW that would have informed them instead of filtering it through staff. And I just want to comment briefly on Mr. Schultz's memorandum, which I would term a hybrid of a bait and switch enterprise and the dog ate my homework. We all know that Mr. Schultz has been pounding the drum to get rid of the ordinance because it wasn't workable and they couldn't make any headway with CDFA and CDFW. And now that headway is being made and the CDFA issue is basically solved and CDFW issue is on its way to solution, suddenly Mr. Schultz switches to saying, yeah, it might be solved, but we can't afford to do it. And including himself, have I been cut off?
You have 30 seconds.
30 seconds, okay. So what is missing in Mr. Schultz's memo? What's missing are the 2 test applications sent for approval by CDFA and the email back from CDFA describing that Mendocino County applicants are, these 2 test applications are very close to meeting CDFA's requirements. In addition, so where are those? Why aren't those included for the benefit of the public and the board? Why is the so-called Appendix G checklist not included in the documents available to the public? And why are the communications with CDFW completely missing? This is a complex.
Okay, thank you, Mr. Drell. Supervisor Williams.
For the record, I'd like to note that the staff has published Measure G. It was attached to a previous meeting.
Okay. Deputy Clerk.
The next caller on the line is Paula Fugman.
Okay, thank you, Mr. Drell. My name is Paula Fugman. Good afternoon.
Good afternoon.
I have lived in Covelo for 46 years. My husband and I We're educators here who built our home, raised our children, and sought to empower our students. I deeply respect the service that you, our local elected officials, provide to us who value life here in the natural beauty which makes the county so very unique. As you know, recently Covelo has had several fires, destroying 6 businesses upon which it depends. The town itself is now plagued with illegal grows that keep popping up and threatening to overwhelm us with a kind of lawlessness that makes our safety and our well-being here questionable. Many of our friends and neighbors have moved, and this exodus deeply saddens me. It is important that the county address this growing criminal element and the illegal grows here. We applaud Sheriff Kendall, who has begun that process and certainly deserves our and your ongoing support. However, as the cannabis industry has been legalized, we appeal to you to support the hard work done by your staff and yourselves, by our environmental spokespeople, by the local legal cannabis farmers and entrepreneurs in crafting a hard-earned and carefully articulated cannabis cultivation ordinance that protects our community from irresponsible, rampant cannabis development on our rangeland, in our forests, and in our timberland. Working with this ordinance, even though costly, is a safe way forward if we are to protect both the citizenry, the legal cannabis industry, and the health of our ecosystem here. Turning over our local cannabis permitting process to Sacramento in any way will be the end of generations of care for our forest, timber, and rangelands. Supervisor Jim Eddy and Planning Commissioner George Hammond and others before you sought to protect the diverse beauty and environment that keeps us all here. We need to accept the costs which are incurred as we make our way to establishing a legitimate and legally conforming cannabis industry. Please continue to support your citizen safety and well-being and protect our remarkable agricultural, forest, timber, and rangeland resources. I encourage you to support the cannabis cultivation ordinance that we have created.
Next up is
Ms. Fugman.
Ellen Drell.
Good afternoon.
This is Ellen Drell. We have I'm speaking on behalf of the Willits Environmental Center. We've supported the ordinance and would like to see it enforced. That it has not been is detailed in our previous written comments. This memo from Director Schultz actually admits that progress is being made between the county and CDFW and the county and CDFA to resolve 2 issues, agreeing on how to determine if a project will harm sensitive species and providing CDFA with additional details on the description of a project site, namely topography and land uses. But staff then claimed that resolving these issues will likely take months and that the cost to the county to satisfy the state's requests would require thousands of hours of staff time and hundreds of thousands of dollars with no mechanism to recoup costs. All 3 claims are highly exaggerated. We have a year-old memo from the state sent to all counties with legal cannabis listing the site-specific information it needs for each application. The list is reasonable. A few weeks ago, the county staff finally got around to sending 2 applications to the state to test Mendocino County's compliance. On July 1st, the state emailed the county with the good news. All the state still needed was site topography, current uses of land, and a description of natural features. Hardly unreasonable. In fact, it's hard to believe the county would approve any application that didn't already have these details. Hurdle resolved. Based on our direct communication with CDFW, regarding the effort to agree on determining sensitive species habitat, we learned just weeks ago that new meetings are scheduled after 2 years of stalling by both parties. And according to the 7/17 email from CDFW, CDFW is optimistic about an agreement. Not perfect, but progress. Another hurdle likely overcome. Then staff throws up a new hurdle, that the county can't afford to assemble the necessary information for the state and can't afford to do the SSR. And the only way to raise the money to do so is through a use permit process in which the county can bill and bill and bill. Staff claims making sure applications included topography, land uses, and natural features would take 16 to 40 hours per application. Applicants could provide that information. The county need only verify it. The staff also claims that in-house sensitive species review would likewise require significant staff time. This needs verification. Staff has said it has people already on staff with the expertise to do the review, and staff pays. The county pays annual subscription fees to the databases for this very purpose, to determine if a project, not just cannabis, but any project, might damage threatened species habitat. Staff, having exaggerated the cost without any real budget, claims it needs a new system that will allow its staff to recoup these terrible costs. So is that the reason for throwing out the ordinance, that the county can't afford our ordinance, or is it just an excuse to open the county to expanded cannabis operations beyond the limits of what our current ordinance allows?
Okay, thank you, Ms. Drill. Next
is Richard Wilson.
Oh, yes, thank you very much. I wish to say to every person testifying, from Burgess right on, Corey Miller right on to the drills, are accurate and descriptions of what's happening not only Round Valley, but to Mendocino County. And this reflects completely on the governance of the county, its board of supervisors, its administration, and administrative officer Carmelo Angelo, and that there is something, as pointed out in this testimony, that has to be done. To take the liberty of the 22,000 votes that said we didn't want cannabis any further than 2016. We've gotten to where we are, and now the county has to take a very stiff hand in putting into play boots on the ground, people getting out, looking at what's happening, and getting out and inspecting these places that they have allowed for growing. Are they complying with the laws? And if not so, then to enforce the laws. It's up to us, with this committee. Mac Kendall, who is grown up here, and I've known him, been here over 50 years. All of everything said, I totally endorse. I totally support the people who are not testifying, but are also very upset. And we, as a group, are looking for Carmelo Angelo and the leadership of county government and the board to take an advanced, aggressive move on what rules they have and to get at trying to enforce these rules and get a handle on this invasion. This is a total invasion from outsiders using our resources. Thank you very much for your attention to this matter.
Okay, thank you, Mr. Wilson.
Next is Ron Stark.
I'm sorry, this is Deputy Clerk Lindsay
Hi,
Dunham.
I'm on the line here.
Just a moment.
So
I'm sorry.
in support.
This is Deputy Clerk Lindsay Dunham. Can I please remind everyone to mute their microphones if they're not speaking? Thank you.
Go ahead, Ron.
Yeah, I'm in support of keeping the ordinance. I think on the June 10th meeting, supervisors meeting, it was stated that turning it over to the state would take over how cannabis is grown. Now, I'm in Covelo. Covelo is totally out of control. Totally out of control. And I totally support Sheriff Kendall and what he's doing, but it needs to be continued in a big way here. There's violence, there's arson, there's cartel, there's, I support the local responsible growers, but the bad part of it is out of control. So it seems to me that if you turn it over to the state with allow more allowable acreage, less control, and less enforcement, that is going to take this situation here and blow it up like COVID, exponential growth. I just can't see how the county can just turn this over to the state, given that, for one. Another caller earlier talked about how the cultivators should be working with the staff. I would say that the staff and the supervisors should be working with the entire community, not just the cultivators. If we have a population here of 87,000 or whatever it is in Mendocino County, and you have 800 people held up in the permit process, then you have 86,200 people that need to be considered as to which direction this county is going. And I would lobby for the supervisors agreeing to not vote on this issue at the next meeting on August 4th, but to open it up to a serious discussion and to present to the people of Mendocino County a detailed description in layman's terms as to what this means, because it's very difficult. You have to, in order to figure out what that means to turn it over to the state, you have to go into the state regulations and try to find out what it means. It's very difficult. And then you have to go into the county ordinance and find out what that means. It's very difficult. So if you put it in layman's terms and present it to the people as an open discussion, and then vote on it, then you have a dialogue going. And I think the supervisors owe it to this county to do that and not rush to a vote on this. Thank you.
Thank you.
Next is Serge Sherbatsky.
Hello, can you guys hear me fine?
Yes, go ahead.
Yeah, my name's Serge Sherbatskoy. I live at 25160 Holds Valley Road, right in the thick of what everybody's talking about. I realize the agenda item actually is to accept or reject the CEO report, and I'm actually urging the supervisors to reject their report because that is their agenda item, because the report itself directs the county to follow the legislation text, which indicates that we should move to a use permit thing. So I think that the local control is really important. I'm sorry, I'm losing my train of thought here. I didn't even turn on my timer. So obviously the existing ordinance isn't working, and obviously there's a need for enforcement. I think those are the two key points here. I think that if the ordinance isn't working, it needs to be restructured in such a way that it's simpler and less costly for the county and less costly for the applicants, and can move forward more quickly. There could be a certain amount of self-certification that could be looked at retroactively if somebody is in violation. And I definitely think that Sheriff Kendall needs to get some more deputies and to get up here and clean out some of these illegal grows. I mean, my female friends are afraid to go to the supermarket because of all the outsiders that are just sort of loitering around the entrance to the store. It's a pretty serious situation here. Generators at night. You've heard all that stuff. So, and I would like to actually refer to something that was said earlier on the COVID section, on section 5A, I think it was in one of the staff reports, but my quote is that someone said regarding the COVID situation and relating to the state, quote, whenever we can keep local control and not turn it over to the state, we do that. So I think that's the main point I wanted to make. The sheriff needs more budget. I've had a huge grow right next door to me. Everybody knows this. We know it's a mess up here. So I guess my main point is that the Board of Supervisors I'm urging you to actually not accept the CEO's report because it contains a recommendation for staff to move forward on the legislation, and the summary request involves repealing the ordinance. So actually, in a roundabout way, approving that report, approving the CEO's report is actually voting to repeal the ordinance. Obviously, the most important thing is to make the ordinance simpler and cheaper for the county and cheaper for the applicant. And we need to get more enforcement up here. So I would urge you to support Sheriff Kendall and to get some more officers on the enforcement. So I think that's all I really have to say. I'm trying to finish in less than my 3 minutes. Thank you very much.
Okay, thank you.
Next on the line is Marilyn McGoffin.
Hi, it's Marilyn McGoffin. I just wanted to say that I totally support all the previous comments, and as another Covelo resident am concerned about what is happening in our valley. Specifically in regard to the CEO's report, my concern as a non-grower, I have a very hard time trying to understand all the ins and outs of the ordinance. I think one of the unintended consequences of our of us people who have not been growing is because we were not involved, we just basically went about our lives, and now we are finding ourselves being impacted by all of the operations that have gone on around us, and are now looking to figure out how we can get ourselves back to what was the lifestyle that we had before. So what my request of the board is to please take the other communities that are in Covelo or in the Mendocino County with regards to the cannabis operations, and because we aren't a formal organization, we don't have a lobby, we don't have a specific group, it just makes it harder for us to now come together and try to express our views. Thanks for your time and attention.
Okay, thank you.
Chair Hashak, we did have 5 other callers signed up, but none of them are on the line at this time.
Okay, very good. So, thank you,
Hashak. Can I comment for just a moment on this?
Yeah, Sheriff Kendall.
First off, I'd like to thank everyone who called in, but I'd like to make it very clear that the board has been extremely supportive of the sheriff's office, as has the CEO, in the efforts to clean these things up. This is one of those things where I have to separate the sins from the sinners, and my fight is with criminal drug trafficking organizations. That is where my fight is. That is where we have to deal with this. We have a lot of people who are involved in the legal growing world who are just as affected as everyone else. And although this is dealing with the cannabis ordinance and the legal growing, yeah, I'm being brought into it a little bit because of the work that's being done against the criminal drug trafficking organizations. But the fact of the matter is I am leaning in on every agency that I can get to help. Mendocino County coffers are not being filled by anything that's coming from these illegal grows. And so I can't expect the taxpayers to take on the burden of cleaning that up. And therefore, we'll continue working with federal agencies, including the DEA, the FBI, the DCEP grant that we're currently working off of, so that we don't have to put the burden off on the taxpayers. But I'd like to make it very clear that the board and the CEO's office has been nothing but supportive of our actions and our endeavors in the Covelo area. Thank you.
Okay, thank you.
Chair Hashak.
Supervisor Williams.
I move we accept the CEO report.
Point of order, we've never taken any action one way or the other. It's simply a report that is submitted. it would be novel if we were to, quote, accept it.
Okay, so if we don't need to accept it, then, I mean, that's a recommended action, but we don't have to. Is that all right, Supervisor Williams?
Well, it is a recommended action on the agenda. I think we should probably follow the agenda. Unless there's a second. If there's not a second, it'll die.
Well, I don't really care that much one way or the other, but people should be aware the act of accepting the report doesn't provide any direction to staff. It doesn't make any decision regarding cannabis. We would simply be accepting it as an informational report, which we could certainly do at the direction of the chair.
Okay, that's all right. We'll just accept it. Is that all right, Supervisor Williams?
Yes.
Okay, very good. Moving on. So item 5F, is there a ledge update?
Chair Haschak,
Yes.
no, there is not a ledge update today.
Okay, so we're moving on to item 5C. Discussion and possible action, including approval of amendment to a legal services agreement number 19-182 with Christiana Darlington, DBA Clear Incorporated, in an amount not to exceed $40,500 for separate legal representation for the Air Quality Management District, effective when agreement becomes fully executed through June 30th, 2021. The sponsor is Air Quality Management District. Is Barbara Moed on the line? Yes. Ms. Moed?
Whoop. How's that? Can you hear me?
Yes.
Okay. Good afternoon. Air District Board of Directors, CEO Angelo, County Council Curtis. The Air District is requesting to renew the legal services agreement with Christiana Darlington for separate legal representation through June 30th, 2021. The attorney's rate is $250 an hour with no minimum hours. Ms. Darlington has over 10 years experience in air quality law, CEQA, and planning, and has been working with the district under contract since November 2018 on matters related to district programs and mandated requirements. Currently, Christiana Darlington is contracted with 2 other air quality management districts, as well as Mendocino counties. So what you have before you today is agreement number 19-182, which the board signed last year. And also you have a 1-page amendment to that agreement 19-182, which simply does 2 things. It adds $40,500 to total compensation payable under agreement 19-182. And it also extends the term of agreement 19-182 to June 30th, 2021. This money is budgeted in the Air District's budget. And just as a gentle reminder, we are not a county general fund department. You know, we have our own budget.
Okay, thank you.
Yes.
Is that it?
Yes.
Okay, and it's the same amount as was last year.
Yes, exactly the same amount, same, yes. And I wanted to keep the terms the same because I know there was some concern about the agreement language last year.
Okay, are there any questions or comments from the board? Supervisor Jurdy.
Just one question. So I just didn't see it in the packet. We have a not to exceed amount and same as last year. What did we actually spend this last year? Do you know?
You know, we spent slightly less than that, less than, you know, off the top. I believe it was less than 5,000 of the cost not to exceed.
So within $5,000 of the not to exceed?
Yes.
Okay. All right.
And also, you know, pardon me, Christiana, I should have said that Christiana Darlington is, I believe, on the line if you have any questions for her.
Okay, and Supervisor Brown.
No questions. I'm ready to move the recommended motion.
Second, subject to public comment.
Okay. All right, any further comments from the board? Hearing none. There weren't any submitted public comments, and I don't see anyone sign up for public comment. So go back to the board. We have a motion, we have a second. Okay. Deputy Clerk, could you conduct roll call vote?
Absolutely. Supervisor Juror?
Yes.
Supervisor Williams?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
And Chair Haschak?
Yes.
Thank you. The motion carries unanimously.
Okay. Thank you, Ms. Moed.
Thank you.
All right. Moving on to agenda item 6B, discussion and possible action, including abatement or including direction to staff to author a hazardous vegetation and rubbish abatement ordinance. Supervisor Brown.
Thank you, sir. I brought forward this agenda item, was going to do it sooner, but because of COVID, there just wasn't the opportunity. I think you can tell by all the public comment, there's a lot of support for the county to go forward for writing an abatement ordinance. I think many people are very aware of the Sonoma County program. It doesn't necessarily, it may not necessarily fit Mendocino County, but we have all been working on wildfire resiliency. And I'm hearing every fire safe council meeting, neighborhood fire council meetings, that this is a huge issue with property owners that are not serious about keeping wildfire at bay. I also wanted to bring everyone's attention to what was submitted by the Redwood Valley MAC, was listed under public comment and also under this item. I think it's extremely important. Don't know if we can make any recommendation this time. Maybe we'll have to wait, but it has to do with vehicle fire prevention. And I think you have all read it, but it makes a recommendation that the county, along with Department of Transportation, recommend to CAL FIRE, well, maybe it wouldn't be CAL FIRE, it's Caltrans, that we send the messages, give that message on their billboards, better known as, trying to think of what they actually call the first program. But I think it's important that the county follow through with that recommendation. I think it's an excellent one. Check safety chains, tires start fires, don't drive on a flat tire. It's all these sayings that Caltrans could post. And especially looking at this year, we're in a drought, only 14 inches of rain in most of Mendocino County. So I'm bringing both of these forward for your consideration.
Okay, thank you, Supervisor Brown. Let's see. Any comments from the board on this?
I have a comment, or maybe perhaps a question for Supervisor Brown.
Go ahead, Supervisor Williams.
So I support it fully. I'm thankful that you brought these items forward. Do you have any thoughts on a population of folks who are on fixed income, know that they should be more responsible about clearing, but simply can't afford it? I could see for some any sort of enforcement coming across as punitive. How can we address that?
I think you can address it through an ordinance, but I myself, in knowing the fire safe councils I've worked with, the neighborhoods help each other. It's absentee landowners or those who absolutely refuse to be involved or to do anything with their property to make it fire safe, especially roadside pieces. So that is something that I think we have to wangle with. But I also feel those that are not taking care of their issue or asking for help among the fire safe councils, people understand, I'm sure, and they would receive help if they would just reach out and be a part of the process. And I have seen that happen throughout my 2 years of working with the formation of these councils and then seeing these neighborhood councils go forward.
I have no further questions and I support it.
Okay. Well, I'm
Chair Hastek.
Yeah, Supervisor McCowan.
Thank you. Yes, I appreciate Supervisor Brown bringing this forward. There's a critical need for some mechanism that will compel people in a neighborhood where they are not maintaining their property, other people are, they're potentially putting the whole neighborhood at risk. What's challenging is Mendocino County, as we all know, very far-flung, diverse. We have rangeland parcels or parcels zoned rangeland, a half acre in size, existing in really a residential environment. We have other large resource lands parcels that butt up against residential properties. So I think it'll be a challenge for county council to devise an ordinance that I believe the intent would be directed at people living in relatively residential areas. So, you know, village environments or other areas that clearly have been developed in a residential way without getting into the question of every dead tree in the county must be taken down or now I can sue you. So there's a real challenge, I think, to fit the properties that we would all agree need to be in compliance with making their properties fire safe without overstepping and getting into a lot of unintended consequences. So I just wonder what discussions might have been taking place along those lines, or am I in the going down the right road and thinking it's geared mainly towards residential properties that, whatever the zoning, are in a clearly residential setting. And then we get into places like, just for example, Rancho Navarro, where you've got 100 plus 10-acre parcels. Would this apply there as well? So a lot to consider. Thank you.
Mr. Chair?
Yes, Supervisor Brown.
I would just like to respond that the devil's in the detail, and I think it'll be in an ordinance that we may write. I think that whomever will be certainly looking at other models throughout the state that have been adopted. And because of hearing earlier today and about, timely items, and also staff time, be it in COVID-19. There was, in one of the letters, comments that we received from the Mendocino County Fire Safe Council. In their letter, I think it was number 11 on our attachments, they said they would be very pleased to offer assistance in researching, best in class ordinances, model ordinances. And so it might be that instead of it going straight to staff, it go to the County Fire Safe Council, and they as a group start looking at different models and bring a recommendation back before it goes to County Council or to any other departments that would have oversight.
Okay.
Thank you. And I'll have one other comment on a related item related to fire safety when it's appropriate.
Okay. Thank you, Supervisor Brown, for bringing this forward. I think it's a critical need, and certainly, people in areas like Brook Trails are very concerned about the absentee owners who leave their properties and don't abate the vegetation, problems that arise there. And Brook Trails certainly has a long history of dealing with these kind of properties. I appreciate the comments from Tamara Alaniz, from the Executive Director of the Brook Trails Township, in saying that she would offer, kind of her expertise and experience from the township's, dealings with all of these deadbeat owners or abatement issues. So I think that's really great. I think that if we went for a grant, I think the Mendocino County Fire Safe Council talked about a grant that they could get to help write this ordinance, because I don't think that, we have the capacity within our county council right now to write up an ordinance within the next 6 months or so. I might turn to county council for any kind of opinion on that. And also, I don't think that code enforcement, if we went this route, right now we don't have code enforcement to enforce the COVID-19. We're having problems with that. We're also having problems with the cannabis. And so to add another whole realm of vegetation management seems like a daunting task for an overwhelmed department at this point.
Chair Haschak.
Well, I wanted to see if county council had an opinion on their capacity to do something like this.
Thank you, Mr. Chair. So I will say we are spread thin at the moment. Supervisor Brown's suggestion of maybe the Fire Safe Council being able to offer some assistance, even if that's just providing sort of surveys as to what some of the best practices or best ordinances are out there. Frankly, that may be helpful. I don't want to say that we couldn't do this, but we may not be able to put quite the amount of time and effort into it that I would like to be able to really sort of fully tackle all of the issues in the first go around. I also just I think that the chair made a good point in terms of the enforcement issue. I would encourage the board to think about that as well. The ordinance may help regardless of what resources are out there, just because people would be aware that they'd have an obligation. But usually to really get good compliance, you've got to have some sort of enforcement behind it. And I think that may be a broader discussion that you want to have with code enforcement at some point in terms of strategies and capacity, et cetera.
Okay, thank you. Supervisor Williams.
Rather than putting this to a vote today, and I understand it does compete for limited resources, if Supervisor Brown is willing, could we ask that she continue working on the idea, researching the best ordinances from around the state, work with Fire Safe Council, and bring it back to us a bit more complete and definite?
Supervisor Brown?
Oh, sorry. I thought Supervisor Williams was laying that out to all of you. I would not mind, but I would like to see direction with a motion in what you said, and directing me to work with the Fire Safe Council. That's perfect. I'm willing to do that because it is a critical issue in a lot of people's mind countywide. But I would like a motion and direction.
Okay, Supervisor Jurdy.
I'd like to make the motion to direct staff to work with Supervisor Brown to develop options for an ordinance as presented.
I would second that with the condition that COVID be placed as a higher priority and as staff has available resources, that we work on this.
Well, I think that morphed a little bit though, because I thought that Supervisor Brown and Supervisor Williams were talking about working with the Fire Safe Council. And then Supervisor Jurdy said staff. So what is it?
Well, ultimately, they have to work with staff because ultimately it's the staff that writes the ordinance. But I think it's implicit in there that Supervisor Brown would be working with the Fire Safe Council to gather up other ordinances from other communities. I do also want to say I really do appreciate Supervisor Brown bringing this issue forward. I had talked to county staff about this very same issue many months ago. Believe it or not, this is an issue on the coast as well. Even on the west side of the highway, there are neighbors, absentee landlords that have created fire concerns in neighborhoods. So I think this really is a countywide issue.
Do you see it coming back to the board before asking council to work on the ordinance so that at least we don't have council work on it and then find that the board has different ideas?
In my mind, I would think that several models, perhaps, would be coming back with board input and comment, and maybe even come back again somewhere, down the road, and then before it goes into staff to really finalize anything.
All right. So we have a motion, we have a second. Are we?
Chair Haschak?
Yeah, Supervisor McCowan.
John, you're on mute.
Oh, did we agree on a timeline for this to come back, at least for an update?
Not yet.
I think when Supervisor Brown is ready.
Okay.
Okay. One other fire-related item I would like to mention. Supervisor Williams and I are on a road naming committee. The issue, many roads are not named, inconsistently named, lack continuity. First responders can struggle to find the correct address in rural environments. Anderson Valley has done a lot of work on this issue. They have templates of how this could move forward. The board previously discussed it, appointed Supervisor Williams and I as an ad hoc. We met with staff. We identified, I think, fairly straightforward ordinance changes that would be needed. Potentially, this is an item that is within an hour of preparation to bring back, and once it's in place, then a fire chief or other responsible emergency responder, it could be the sheriff, could identify roads that need to be named to provide easier means of actually responding to an emergency. I think we all understand this is critical based on recent experiences. I'm hopeful that that's one item that's fairly straightforward that we could be seeing come back, possibly even on consent. I think the board was supportive of the issue. I know it's not on the agenda for today, but we're talking about the larger issue of fire safety, and this is another of a number of things that have been deferred that could be life-saving in an emergency.
Excuse me.
Mr. Chair, you're on mute.
Thanks. We have a motion. We have a second. We understand the motion. Could you repeat the motion, please, Deputy Clerk?
I was going to ask you the same thing. This is Deputy Clerk Lindsay Dunham. May I please have a restatement of the motion and how it varies from the recommended action?
Okay, Supervisor Jurdy.
The motion would be to authorize Supervisor Brown to work with Fire Safe Council and county staff to bring back options for in ordinances.
Okay.
Thank you.
Could you conduct a roll call vote?
Absolutely. Supervisor Williams?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Chair Haschak?
Yes.
And Supervisor Jurdy?
Yes.
The motion carries unanimously.
Okay, and I'd just like to say that Supervisor Jurdy and I go to the Caltrans meetings with all the appropriate agencies dealing with transportation and the roads. And so we could bring that issue up about the signage and those messages that the Redwood Valley MAC brought forth. And
thank you so very much. And you will see it represents an example of what volunteers, good citizens that step forward and put together input. I was very impressed with the work done on this.
Okay, so very good. Thank you, Supervisor Brown. With that, we have a timed item at 3:30. So we're going to take a 10-minute break until 3:30 and then come back and go into that. And then hopefully at the end, we can deal with the time-sensitive matters. Okay? Very good. Until 3:30. you. Welcome back, everyone. And now we're on to agenda item 6C, which is discussion and possible action regarding the impacts of COVID-19 on racial and ethnic minority groups, current national, state, and local data about COVID-19, and the importance of addressing health disparities, and proposed interventions and recommendations from the Mendocino County Latinx Alliance and the Health and Human Services Agency. So I'd like to say bienvenidos a todos to this presentation. Good afternoon. This item was to be presented in March concerning issues of importance to our Latinx community and the community at large. With COVID-19 and its particularly devastating effects on the Latinx community throughout our country, and the fact that over half of our Mendocino County cases are in the Latinx community, this presentation is especially important. What we're looking at is to raise awareness of existing health disparities and impacts of COVID-19 on racial and ethnic minority groups, and see what we can do about it. And we certainly have a wealth of great information. I've been working with Tammy Moss Chandler from Health and Human Services and Roseanne Ibarra from the community at large, and also from Adventist Health, working on this agenda. So I think that we have some great speakers today. And one thing about the translation is that Ricardo Ibarra will be doing the translation for those who are Spanish speakers, and he'll be translating it into English. For those who are Spanish speakers who want to understand what we're speaking about today, that we will be having a special presentation that Latinx community has set up for this Friday, the 24th at 1 o'clock, and we will have the same speakers then. And so we hope to get this information out to the community at large, and we have a plan to do that. So I'm very excited. You know, Dr. Duhan and CEO Angelo brought this issue up that we should do it, what we were planning to do in March, to do it now because of the importance of getting this information to everybody. So I'm excited about the presentation today, and I'm going to turn to Dr. Duhan.
Thank you. I assume you can all hear me?
Yes.
Yes. I want to share some wonderful news today that we have, who I'm going to call a local hero, a physician, Andy Corin, who the Board of Supervisors have voted in to be our next health officer, and he is bilingual in Spanish. So while my parents are bilingual Spanish speakers, that was their language, their secret language, where I could hear it and I understand it, but I wasn't speaking it growing up. And so that's one of the things that I have not been able to be of service to our community to the extent that I wished I could, which is to be bilingual. But Andy Corin is bilingual. So as we continue to work together here to do a better job for our Latinx community, I am happy to share that our health officer who's going to be coming in is bilingual, and he for sure will be able to serve our community more fully because of this language ability that he has. So here in Mendocino County, should I be stopping in order to have what I'm saying in Spanish interpretation, or just speak in English at this point?
You're just going to speak in English, and we are going to have this translated. Friday, we will do the translation from English to Spanish.
Okay, okay. Here in Mendocino County, we have been responding to the pandemic with full force and energy since January. And from the beginning, I said that there's two elements to our COVID response. One is containment, and the other is mitigation. For containment, what we do is we do testing, we make sure that we identify people who have COVID, we get them into isolation and their close contacts into quarantine. Mitigation, these are the things that we do to slow the spread, flatten the curve, the wearing of masks, the keeping 6 feet apart, saying stay home when you're sick, frequent hand washing. Another element to the response to a pandemic when we don't have a vaccine is communication. And we have not been doing enough for our Latinx community regarding communication, because there has been an absolute emphasis on English language communications. I myself am not bilingual. And while we have made an effort, I am so grateful for today's event, because this is what we need. You all coming together with us is what we need. We need the community support and the leadership in the community from the Latinx community, so we can do a better job of communication on the county side. As of today, we have 207 total cases of COVID-19 in our county. That is about, we're starting to get into a period where we're seeing about a doubling of cases about every 2 weeks. So it was about 2 weeks ago that we had 100 cases, and now that we're at 200. Of these 207 cases, 59% of them have identified themselves as from the Latinx community. So some people have asked why in our ethnicity that we put up on our data tracker, have we not, for example, listed people that are African American? And the reason is that we didn't want, if we have a population that does not have a large number of people from that group in the county, and we're announcing by region, we didn't want to be able to identify who that person might be, because it might be identifiable if there's one African American in a small part of our region, of our county. So that's the reason in the past we have not specified other ethnicities and races, but we will be looking at that in the future. But in our tracker, you will see that we have identified Hispanic Latinx community, and that there's 59% of our 207 cases are from the Latinx community. We also look at how many people are currently in isolation. So they currently have been tested for COVID and they're in the infectious period, which is what we use in the public health department is 10 days from the test date. From that period, they are considered in the infectious period, but they as well need to be improving and without a fever. So when we say someone is in isolation, they're generally within 10 days from their test date. So we have 56 people in our county right now in isolation from the Latinx community. That's 63% of the cases. In our hospital right now, we have 9 people hospitalized and 1 from the Latinx community. So 11% of our hospitalized patients are from the Latinx community. So that is actually what we've seen in other communities around California, that while we have a disproportionate number of people from the Latinx community as cases, we do not have in the hospital necessarily that disproportionate number. And on the side of the health officers, what we're thinking is that that is because the cases in the Latinx community are tending to be younger people that are overall healthier and aren't having the complications leading to hospitalizations that we generally see in older populations. So one of the things that we've seen across California, for example, is that the deaths that we've experienced in our counties are mostly in elderly population, and in particular from skilled nursing facilities. So we've had 3 deaths attributed to Mendocino County, 2 tragically over the weekend from a skilled nursing facility in Fort Bragg. The 2 that died in the skilled nursing facility in Fort Bragg, Sherwood Oaks, 1 is Caucasian and the other is not has not disclosed an ethnicity. And then the first case that we had that was a death, which was attributed to an infection over a month ago, was also Caucasian. So at this time, we do not have any deaths attributed to Latinx people, and 11% of the hospitalization at this time, 1 being in the hospital right now out of 9, and 63% of our isolation cases, that's 56 people. So regarding isolation, this is an area where we've worked very hard on the side of the county to provide isolation and quarantine housing, because what we know about COVID is it spreads like wildfire in households. That's because it not only spreads by the respiratory droplets when someone coughs, but it also spreads because those droplets hang in the air. So if you have a household where it's enclosed, windows aren't open, for example, and there might be people in close proximity to one another, COVID spreads very easily in that type of environment. And also the respiratory droplets can sit on surfaces for 72 hours and still be infectious. So a lot of the cases that we've seen in California have been from households, people living together in families. And so that's why the isolation and quarantine housing is so important. We at the county are providing free isolation housing for individuals that are unable to have isolation in their own home. That might be because they don't have a home, or it might be because they live in a home where have close family members in close proximity. So the way we've been doing that is in hotels, that we hire a hotel room, we rent a hotel room, and we provide that for free to the individual during their isolation period. And then we arrange for food and other necessities to be brought to that hotel room when the person is in isolation. We also are moving towards having isolation and quarantine housing that is together instead of individual hotel rooms, but we do have, for example, in Ukiah, Whitmore Lane, which is a nursing home that we have commandeered to be isolation and quarantine housing. We haven't opened that up yet because we needed the staffing to staff it. And when we only had small numbers of cases, we could put one person in a motel room, and that was manageable because we didn't have a lot of people all at once. But now as we start to get into numbers like 56 people in isolation, and of course that period, ends, people essentially recover and get out of isolation. But I expect those numbers to keep going up. 56 people in isolation from the Latinx community, we can see how we need to be sure that we have isolation housing that is geared towards the Latinx community. In other words, we need to have Spanish-speaking staff, and we need to be able to support our community when they need this housing.
Okay, Dr. Duhan?
Yeah.
We need you to wrap it up.
Okay, I think that would be a good wrap up because that would be an emphasis that I think we would need to discuss. The final thing would be about communications. We need to do a better job. And I'm not sure exactly what that better job will mean, but I'm looking to all of you to help us understand how we can do a better job to communicate with our Latinx community. So thank you.
Okay, and I think that we will have some ideas by the time this item is over. Okay, it's my honor to introduce Dr. Sergio Aguilar Gaxiola. He's the founding director of the Center for Reducing Health Disparities at UC Davis. And he's going to talk about national and state data and how that might impact us in Mendocino County. So welcome, Dr. Aguilar.
Thank you so much for the kind introduction. Can you hear me?
Yes.
Yes, and I really appreciate this opportunity to share some thoughts and some statistics as well. At the national level, the state level, and also at the local level. And so I'm going to share my screen if you don't mind. Okay? It's going to take me hopefully very little time to do that. And can you see my screen?
Yes.
Okay, so I'm going to put it on slideshow. And I'm going to What I would like to share with you is what a difference 2 months make, because things have shaped up in such a way at the national level and certainly at the state level and in some specific counties with specific communities. And, what has emerged is this important disparities of specific communities that are getting infected and also dying in disproportionate numbers. So what I want to first share with you is this is a recent numbers that the New England Journal of Medicine in something they call the Journal Watch, that intended to portray the uptick of cases that we have had nationwide. Significant increase. California hasn't been the exception with this. Actually, California is experiencing this uptick. This is a very important article that appeared on the New York Times, in which they included these important curves that you can see here. And what they were reporting is that Latino and African American residents are 3 times as likely to become infected by the coronavirus as white residents, and nearly twice as likely to die. And this is becoming more or better known. Certainly California, as I will share with you, has seen this clearer picture about these important differences of not only those who get infected with the virus, but also the cases. This is in California. This was in the local paper where I live. I live in Sacramento County. And what you see there is that you have Latinos specifically with a significant increase in number of cases, and also a significant increase in number of deaths in relationship to the population. And we are also experiencing some of these, especially in the number of deaths in the African American population in California. And that is as of July 1st. Many more cases have been reported up until July 21st. So this is just a picture of what was happening back in April of 26th, which is about the time that the California Department of Public Health started to post the number of cases and the number of deaths by race and ethnicity. And not only they did that, but they posted the differences in by race and ethnicity and age groups. So this is how it was looking a little about, 3 months ago, April. Let me show you this. This is in the case of Latinos. The percent of the population is 39%, and the percent of deaths at that time, and I'm going to be focusing primarily on percent of deaths, was below the percentage of the population, 33%. And with African Americans, actually, there was a more significant disparity. It really was almost double the number of deaths on the proportion in the population. Fast forward this to July 8th, and these are the numbers as of July 8th. I have seen almost daily the cases, so it is a little bit of a different picture right now. But in the case of Latinos, and this is all the ages, together, the number of deaths was higher than the percentage of the population, and same thing with African Americans. But the real story about this is when we look at the data broken down by age groups. So what you have here is ages 18 to 49, and that is back in April 26. And I want to just bring to your attention that at that time, 60% of the deaths in Latinos 60% were happening with Latinos, a higher number of their distribution for that age group in the population. And same thing with African Americans. From 18 to 49, which was reported then, with African Americans, it was triple their percentage in the population. This is, once again, fast forward to July 8, and this is the picture that we were getting then. There was a significant increase in the percent of deaths in Latinos above the population for this age group, 18 to 34. Same thing with African Americans. But I think that one of the, this is 35 to 49, and this is one of the lessons that I think that we ought to look at. Because if you take a look at, this particular number here, which now is almost 80%, when you consider the age group of 35 to 49, 4 out of 5 who die in California are Latinos. And of course, we need to ask the question as to why is this the case? And I'll share with you some thoughts related to that. With African Americans, this is the picture. Still there is a disproportionate number of deaths, not as pronounced as it is with Latinos. And if you consider 50 to 64, there are, once again, a disproportionate number of Latinos. And certainly for African Americans as well in this age group, almost double. And this is, if you consider 50 to 64, double the number of deaths for Latinos, and a little bit over the distribution in the state of California for African Americans. The other thing that I want to emphasize is, as you can see, there has been a disproportionate number of Latinos, especially Latinos, now more than African Americans and any other group, if you consider number of deaths. This is also problematic with tribal communities. I want to just emphasize that with Navajo Nation has been particularly pronounced, the number of cases and also number of deaths. And if I can just very quickly read here in a recent article that was published in the CDC, Preventing Chronic Disease, that I will refer a little bit later. My friend and colleague, Lloyd Michener, who is the lead author of this paper, says that the Navajo Nation, among other tribes, is facing some of the worst rates of COVID-19 in the United States. Long-standing health inequities due to persistent federal neglect, a high prevalence of chronic disease, which has been one of the issues with the Latino community and the African American community as well, and geographically dispersed multi-generational homesteads, often with no running water or internet access. These are some of the factors that have been identified related to the spike on cases and also deaths in the Navajo Nation. So one of the questions is, what is at work here? Why are we seeing these pronounced disparities? Well, there are several reasons described in this slide that the Substance Abuse and Mental Health Administration provided. Like we know that people of color are at an increased risk for serious illness because of the comorbidities, the coexistent chronic health conditions that they suffer from. including diabetes, hypertension, obesity, and this is compared to whites. Also, they are more likely to be uninsured and to lack a usual source of care. These are barriers of accessing, testing and also treatment services. They are more likely to work in the service industries, the workforce that has been called essential workers, and also more likely to live in housing situations. This is something that we have seen over and over again. That Latinos usually come home when they go to work, come home in households that in which there are many people. The other thing is that in the household, with some frequency, there are multi-generational families with the small quarters. These are primarily low-income and public housing, in which it's very difficult to keep physical distance. The other thing is, and I have been following specifically farm workers, that if they go to work, they need to get public transportation, and increases the chances that they are going to get infected as well. And in the places of work, with some frequency also, they don't provide adequate personal protective equipment. So there are some of the reasons associated with that. A few days ago, there was this report in the Sacramento Bee that says, as California scrambles to respond, there is the question of whether officials should have noticed the surge in cases among Latinos sooner and acted more assertively. But there's a more pressing issue, but this is a more pressing issue now. Coming locally to you, I have been following your statistics, from your website. And the latest one that I got as of yesterday is this one. You have, by the way, a wonderful dashboard. I want to congratulate you for that. And you also have it in Spanish, which is just terrific, about informing the public. But the numbers that I want to emphasize here, and this is once again as of yesterday, is these differences by ethnic and racial groups within your county, a county of approximately 90,000 population that you have. And there is this significant, if you consider a total of 207 cases as of yesterday, 122 have been, are cases within Latinos, that puts them at 58%. And with a significant disproportion, in terms of the percentage in your population in Mendocino County, which is about 24, 25. You know better than myself. And I have a slide just to that effect that I'll share in just a minute. You also have only 3 deaths, which is remarkable. Let me tell you, you are doing things that are remarkable, because unfortunately that is not the case in many, many of the counties, especially in the Central Valley, that I have been following the cases and the deaths by race and ethnicity. So you have a unique opportunity here to continue to do the things that you are doing, and even do more, especially to address the issues that you are having with your Latino community. And we'd love to discuss that a little bit more with you, and to provide some recommendations. This is the population, and there are different estimates, by the way, but this is one that seemed to be, informative about the approximate percentage of Hispanics or Latinos which is about 25%. One thing that I would like to recommend that you consider, and this is something that fortunately is happening in Sacramento County, is the need for timely data, for example, geomapping or hotspots that can help strategize and come up with community-based approaches to prevent the spread. If you know where there are outbreaks specifically or those reported cases, then you would have a sense as to specific places in which you can possibly intervene. One thing that I very quickly want to share with you is this slide. I watched this earlier, noon to 2, in this national forum with the director of the National Institutes of Health, Dr. Francis Collins, and many other people across the nation. And the focus was the role that community and community engagement plays in controlling the spread. And I borrowed this from a colleague who was presenting precisely on the importance of community engagement. So these are barriers to engaging communities in COVID-19 initiatives. There are direct barriers and indirect barriers. Direct, and you have some examples there. Ineffective communication about COVID-19, language and culture played a key role. And I'm glad that Roseanne is going to be speaking about that. We have been discussing a few things. And thank you, Roseanne, for the kind invitation also to be in the wonderful event that you're having this Friday. It's my pleasure, my honor to be a part of that as well. Also, misinformation about COVID-19, 3 simple public health measures that I think if we were to observe and be disciplined about it, and that is, what Dr. Frieden, an ex-director of the CDC, what he called the 3 Ws, wear a mask, watch your distance, and also wash your hands. 3 simple, and if for us, those of us who speak English, if we remember the 3 Ws, it is so simple to remember to do these 3 things. Concerns about safety of the COVID-19 tests in Yolo County. Recently, we did in 3 housing, migrant housing settlements, a survey to ask about what are the concerns that the primarily Latino households in those particular centers are experiencing, and there are fears, that are happening that is so important to keep in mind, to really have a finger on the pulse directly from the populations that are, affected. Also, there is limited access to COVID-19 care. Along with that, sometimes the test results can last, as we have seen, a week or even 10 days. I can tell you that anything that is more than 4 days or 3 days in delaying the test results is useless, totally useless. So I think that it's important to keep that in mind. Also, fears, as I mentioned to you about contact tracing, about the information that to be shared with law enforcement. There is a lot of mistrust, let me tell you, of government agencies that really need to be considered carefully. A stigma related to COVID-19, hyper-awareness of COVID-19 disparities, and indirects, indirect barriers. And these are more related to the social determinants of health, loss of income, no paid leave, no health insurance, no resources available for self-isolation, unable to grieve, honor the lives of those lost, etc. No funds distributed equitably as well. I would like to share with you my colleague Lloyd Michener and many other colleagues from around the nation. We published this article once again in the CDC's Preventing Chronic Disease. I'll be more than happy to share that with you. But there are some pointers that we include, and this is on the request of the CDC, to highlight what are our recommendations about that. And one thing that I want to emphasize is that one of the reasons the title is Relearn from COVID-19 is that there has been lessons that we have learned in AIDS, in the AIDS pandemic, in the SARS pandemic, and that is that health and health equity begins with communities, that we really need to work directly with the communities. I think that that's one of the strong messages that I would like to leave you with. There are some public health implications. Some of them, of these, can be done immediately, like engagement with communities early and throughout is critical. To gather timely data on those affected, testing is of critical importance, and providing the results, of course, is of critical importance. Also, meaningful engagement, partnerships, and trust of the communities. So the involving the communities that are affected, once again, is key. And finally, engage communities as partners in addressing what matters to them. We need to be listening rather than imposing what we think is going to work out. This is about case investigation and contact tracing, because once you have testing, and my hope is that in your county, I don't have a good finger on the pulse, how many community stations do you have for testing, and how relatively easy it is to get tested and then to get the results. That these are some of the things that we strongly recommend. In terms of once you test to determine who are cases, positive cases, and then in the contact tracing, there are some pointers here, like moving very fast is crucial. Thoroughness, accuracy also is crucial. Persuasive communication, and I'm very heartened with the work that Roseanne and her coalition are doing, because they are tackling exactly these kind of issues, how to best communicate and simplify the messages that lead to behavioral changes, not just knowledge. It is okay to have the knowledge, but what we want is for people to change their behaviors. Also, isolation and quarantine. And I was very interested in hearing Dr. Duhan about the update that she was provided to you. Also, there are others. I won't go through this because you have the slides, and you can go to the specific details that I have on the slides. But integrate the testing with case investigation and contact tracing to community health centers, preferably for one-stop shopping. So you have symptom recognition, seeking advice, testing, diagnosis, case investigation, contact tracing, isolation or quarantine, and safe recovery. And something that is so critically important to do is to build on the infrastructure that you already have with groups that already have developed trust. Trust is of critical importance here. And, in Spanish, we call it confianza.
Okay, Doctor.
Yes.
Aguilar, let's see. Could you wrap it up so we could?
Yes,
some questions?
absolutely. This is the last, this is the last slide that I think that I have. And that is, don't forget the mental health crisis as well. It has been kind of invisible. But one thing that is of critical importance here is that we know, because of previous pandemics and disasters, that even though the pandemic may be gone, the mental health consequences are going to stay for much longer than that. So with that, I'm going to finish. And thank you so much for the opportunity again.
Well, le agradecemos. That was very good, and thank you.
Muchas gracias.
We're doing a lot of those things in this county, but certainly there's more to be done. I wanted to see if there were any questions from the board right now to Dr. Aguilar. Okay, well, not
Can I just make a very quick observation and emphasize it, is that you have a unique opportunity because of the relatively low numbers of cases that you have. You have only 3 deaths. You have a unique opportunity to ramp up, your efforts to prevent, potentially more cases and certainly deaths. And I'm really interested. That's one of the reasons I was so interested in addressing you. And once again, thank you for the opportunity.
Okay, well,
Chair Haschek.
Yeah, Supervisor McCowan.
Thank you, Chair Haschek. I did have a question, Dr. Aguilar. One of the problems we're encountering, which is certainly not unique, there is a great deal of suspicion or distrust, or certainly at a minimum caution, on the part of many members of the immigrant community from wanting to come forward and identify themselves. And so we have, I think we have some reluctance. Certainly if I were to approach someone and say, oh, we need to do some contact tracing with you, and we need to talk to everybody that you've been in close contact with over the last few days or so, there's a lot of resistance to that. There's fear that this somehow could lead to encounters with law enforcement or the immigration authorities.
Yes.
Other than we really need to have more people that that reflect the community we're outreaching to, do you have any suggestions on how we could gain the trust of people who we need to reach out to and get their support in order to help keep them and their family and community members safe?
Yeah, thank you, Supervisor McCowan. That's a wonderful, wonderful question. And I think that the first thing that comes to mind is to have a good sense. And I think that Roseanne Ibarra and other members of the coalition that they trusted community leaders or CBOs or groups that through the years, they have gained trust in these communities. Now more than ever, it's important to tap into them. And for example, in Sacramento County, we had we have about 6 community sites for testing, and one of them is at the Mexican consulate, for example. And it is remarkable how many people, when that was put to work by one of the health systems, ELICA, the number of people who came to be tested, and more than any other community settings. And the reason is that those, for example, who are afraid of providing personal information, they felt safe in a place like that. And so I don't know if you have in Mendocino. I don't think that you have in Mendocino a Mexican consulate. I think that the San Francisco one covers you. But at least I know that there are CBOs that can serve, in those roles. But my strong recommendation is to do an environmental scan. And I have no question that Roseanne can help with that, and the other Latino leaders that I see in this particular session that can be helpful in that regard. But it is so important to do it.
Okay, thank you very much. We're going to turn this over to Roseanne Ibarra, who's the co-founder of the Mendocino Latinx Alliance. And welcome, Roseanne, and thank you for all your work on this.
Thank you, Supervisor Hashcheck. Let me pull up my screen here. Okay. Slideshow mode. All right, thank you, Supervisor Hashcheck, members of the board, CEO Angelo, County Counsel Curtis, Clerk Denham, Dr. Duhan, and Dr. Aguilar-Gaxiola. My name is Roseanne Ibarra. I am the Director of Community Integration for Adventist Health, Ukiah Valley, Howard Memorial, and Mendocino Coast Hospitals. I'm here as I'm a founding member as well of the Mendocino Latinx Alliance. I'm here today, this afternoon, representing the joint Latinx leaders in Mendocino County. We stand in solidarity to bring forward important requests today to the Mendocino County Board of Supervisors. This group of Latinx leaders includes Mendocino Latinx Alliance, which is countywide, Ukiah Vecinos en Acción, serving the Ukiah Valley, La Coalición Latina de la Costa de Mendocino, serving the North Coast, South Coast Latino Coalition, Nuestra Alianza de Willits, Sueño Latino, serving Anderson Valley, Periódico Al Punto, our Spanish language news, serving our entire county in print and online media coverage, and Mendo Latino, our countywide bilingual radio show on KZYX. These leaders, we've been meeting since September of 2019 for the purpose of sharing information, for collaboration, and to support one another in our work. We first came together to strategize on how best to disseminate information to our communities on the importance of participating in the 2020 census. In May, Ukiah Vecinos en Acción reached out to us to bring us together around common concerns we had regarding the lack of COVID-19 information in Spanish. We had lengthy discussions about how during the weekly COVID updates, the only portion available in Spanish is when there are questions from Al Punto. We absolutely appreciate these efforts, and we thank Al Punto for their coverage. But we would like to see that the entirety of the important information that Dr. Duhan shares be relayed in Spanish. We also discussed the fear among our community and the misinformation that's circulating. A comment was shared that a community member was fearful to be tested because they were scared that if they did test positive, they'd be removed from their family. There are also concerns about healthcare costs, as many of our population don't have an established primary care doctor. We thank the county for translating the COVID-19 dashboard on the county's novel coronavirus webpage. This was done on July 1st. Our overall concern from the group is that Spanish translation and interpretation has been an afterthought. According to the US Census, Latinos comprise 27% of the population in Mendocino County. According to the California Department of Education, 45% of our kindergartners for the 2019-20 school year in Mendocino County are Latino. We are a significant portion of the population, and our numbers are growing. Many of our community members have limited English proficiency. Information in Spanish is essential. This issue becomes even more critical as we've seen our COVID cases spike, and the majority, close to 59% of our current cases are Latino, and the majority within that subset are monolingual Spanish speakers. Our group developed a joint letter, which was included in your agenda packet materials for today, that lists out the following requests. Please know this is not an exhaustive list, but is put forward as the most critical action steps needed at this time. They include provide all information in both English and Spanish, make translation mandatory in the county's emergency response plan, add California certified interpreters to the annual county budget, allocate enough time during press conferences so that the same information is provided in both English and Spanish, host bilingual public community forums for feedback on county services, create an equity, diversity, and inclusion task force. The vision for this task force is that it would be countywide. It would include county staff, community stakeholders, including law enforcement, business, and nonprofit leaders, to reach mutual agreements on procedures for equity, diversity, and inclusion. It is essential that this task force be informed by the community and that there be a community voice represented here. There would be clearly defined goals and a timeline to implement action steps for the overall purpose of improving community well-being. Here's the vision for some of the goals for this task force. Foster safe spaces to have difficult conversations about race, equity, power, and privilege. We must recognize that these issues are pervasive and impact our community in many different ways, often unconsciously. We must be able to explore these issues fully without fear and judgment. Fostering an inclusive workforce that feels valued and engaged. We must work towards having work environments and leadership that is reflective of our community. For those of us in communities that have been historically disenfranchised, we continue to be unseen. It is important to have diversity in the workplace so that those diverse perspectives can be heard. Encouraging curiosity, self-awareness, leadership, and trust. These skills are essential for building inclusivity. They must be fostered and grown in our community. Encouraging all staff to play a role in addressing behavior that is not supportive of equity, diversity, and inclusion. This should be done to create new norms and habits. To encourage and reward all staff who make equity, diversity, and inclusion a part of the organizational culture. To build cultural and linguistic competence. To prioritize equity by providing access to information for monolingual Spanish speakers. To include translation in the county's emergency response plan. To ensure equal access to programs and services for all individuals with disabilities and limited English abilities. To identify communities or groups that may have limited access to services and to address those barriers, disproportionality, and inequities that exist. For each board of supervisor to host bilingual public forums in their district for community feedback on county services, and for a specific issue related to health equity, to bring together law enforcement, mental health, and healthcare to reach agreements on the protocols that will be followed for care, safety, and dignity of mental health patients. Plans for this task force are still under development, and the joint Latinx leaders will continue to define this work. Today, we heard from Dr. Sergio Aguilar Gaxiola. Thank you for your powerful presentation and the information you shared with us today. To enhance the efforts made by the Joint Latinx leaders, Mendocino Latinx Alliance has organized a speaking program on health disparities the Latinx experienced during COVID-19. This will be our first ever bilingual virtual program scheduled for this Friday, July 24th, from 12 o'clock to 1:30 p.m. via Zoom. Dr. Aguilar Gaxiola will be speaking along with Dr. Noemi Duhan and George Verastigi. There's an English and Spanish flyer that's been circulating in the community. You can find the Zoom link on this flyer. The program is free and open to the public. For this webinar, we have a maximum capacity of 100 participants, so please be sure to log in early. It will be available on the Mendocino Latinx Alliance Facebook page and on KZYX. Please join us for this exciting program where we will further explore health disparities, the impact of COVID-19 on Latinx, Native American, and African American populations. This is the Spanish version of the flyer. And now we will hear from community members, including Loreto Rojas from Fort Bragg, Javier Chavez from Gualala, Hailey Becerra from Fort Bragg, Maria Avalos from Potter Valley, Brenda Moreno Sanchez from Ukiah, Miranda Ramos from Fort Bragg, and Fabiola Cruz from Ukiah. My colleagues will be speaking in the language that they're most comfortable using. Ricardo Ibarra will interpret comments that are made in Spanish. And I now turn it over to Loreto.
Buenas tardes.
Buenas tardes.
Muchas gracias. Thank you so much for inviting me to this meeting. I think I have decided to speak in English since I see I only have 5 minutes and I don't want to take half of that for translations. So I'm going to speak in English since I can. I want to give a little bit of feedback about what's happening in my neighborhood. I live in Mendocino near Fort Bragg, in the town of Mendocino. And when the pandemic started, I tried to reach out to the people I know. I'm part of this group. It's called the Latino Coalition of Fort Bragg, or the coast of Mendocino, I think is the name, for several years now. And one of the first things that I encounter is that it's really difficult to find the information about the programs and services that are available for the Latinos in their own language. And even when you are able to find that information, many times the form that needs to be filled up is in English. And so I had to do research, call people, randomly people, not often people will call me back about my questions, which is very frustrating. And I have heard this from several people from the community, that they have obtained phone numbers I have given them to apply for help, and local organizations. I don't want to mention them here because everybody knows who is offering what. And they haven't received a phone call back. Many times these phone lines were busy, which is understandable. But when they were able to reach these phones, there were no call back when they left a message. I encourage people to keep on calling, but they are very suspicious they are going to get anywhere about this. This also has happened with organizations that were helping the local micro and small business, where people are not getting phone calls back, which is very frustrating for them. I have tried to help them as much as I can, and some people have obtained help, others not. Naturally, this reflects the lack of confianza, trust that Dr. Sergio Aguilar was talking about, because people don't feel that really are heard. The same about the idea that they don't have access to the real information. They are very afraid of being tested, or they are afraid They don't know if COVID is real or they are just going to be turned into the hands of the law. Some are undocumented and live really in the shadows, and it's a very difficult situation for them. So I wanted to mention this is what I hear from the Latinos I talk to. So the other thing I wanted to say is that I believe we need a more thoroughly translation of documents. Even the convocation to this meeting, it was poorly translated into Spanish. I hope you don't take this with a grain of salt because I'm a Spanish professor. But in reality, if any of you go to a foreign country and you read information in English that is poorly written, you really feel bad about yourself. That you feel that you're not getting the information that is properly or rightfully yours. So I hope you understand when you read something that is poorly written in Spanish, it really discourages many people to trust what is being said and conveyed. So this needs to be fixed. Also, I wanted to mention that in my point of view, the work that needs to be done is exactly what Dr. Sergio Aguilar was talking about, which is, and also Roseanne was talking about this, which is to create a more engaging community through programs that will address issues that transversally affect to that community. So I think it's very important to start in a place that the issue touches everybody, and little by little gaining the trust of the community and offering this education. I think education is at the base of our discussion because you have to be quite educated, not only in academical terms, but also in the use of technology and accessing to files, websites, learning how to navigate, how to fill up these forms, and understanding the language that is conveyed in these documents. And finally, I would like to say also that in my point of view, it's very important to have certain social strategy that will allow us, all of us, to work together and have a more synchronic efforts. Because in Mendocino, we have a rich array of programs, resources, interested people in the benefit of the community at large. We are a very impoverished community. Poverty crosses everybody, not only the Latinos. Perhaps we are the most visible because we usually have several jobs and we are hardworking people. We don't have access to all the information of the services that are available. Latinos are not receiving the help that they could have gotten if they have known about it. And I know this is a really big issue. So I want to encourage every one of us, including myself, neighbors and authorities, people, officers in important positions of power, to work together and in synchrony to help the Latino community and benefit the community at large. Thank you for listening.
Thank you, Loreto. Okay. Roseanne, are you going to bring up the next speaker, Javier?
Javier. Hello, can you hear me?
Yes.
Yes. Okay, well, first I really want to thank everybody for listening to us. I really love the presentation that Mr. Sergio Aguilar Gaxiola did. It was pretty amazing. I haven't seen anything like that, I guess, because we're over here, you know, kind of isolated, but thank you. Thank you very much. My name is Javier Chavez. I'm the community liaison for the community clinic here in Gualala and Point Arena, RCMS. And I'm also a representative of the South Coast Latino Coalition. And this is Latino leaders that live in Manchester, Point Arena, and Gualala. We are a brand new coalition, but doing you know, some amazing things here in our area. And I want to first share with you about the first case. If you guys remember, the first case that happened it was here in Mendocino County. It happened in a restaurant. The people who had to be isolated were Latino. The reason I know all this is because I was involved in helping the family. It was a family of a mom and dad and 2 kids, and we were involved with them bringing food to their house. Their papers were not in order, and they couldn't get any type of health care. So the community got together and say, hey, how can we help them? We took food to them while they were in isolation. When I talked to him, he said when the county car came and visited him, his blood went, all the way down. Really afraid of what's going to happen. And I don't want to forget that part. I really want you guys to see if there's any way that you can bring a translator or maybe a bilingual health worker when they come and visit the families, because that is really scary. Just looking at the marked car or things like that. But anyways, so that's what I heard from him. And no health insurance. No other resources. The only thing that he had was the community to come and help him out. And he said it would be really difficult for me to do this again because it was so hard. So so that's he was supposed to be here today and speak, but obviously his work right now is more important to him than coming and speaking. So sorry to say that. I also talked to the Catholic priest just to get his idea on why he thought that people weren't accessing the testings. Because we have some testings here in Gualala, and this is what he shared. He shared, one of the most important things or the most common things that I hear from my Spanish-speaking community members is that they don't have health insurance. So if they go to get tested and that they are found positive, then they think that the cost is going to be really hard right now, especially when they're not working a lot, because everything is working half time. So this is from actual community members that we've come across. And I think, Dr. Garciola already went over some of them, which is being stigmatized that they have the virus. Again, their immigration status, and again, we're talking about the essential workers. These are the people that right now are working at the local supermarkets, at the vineyards, doing house cleaning. Here, there's a huge house cleaning industry, and those are the people that are more at risk. So this is just what I hear from me as a community liaison to the community. Why our locals here in Gualala, Point Arena, and Manchester are not accessing healthcare. I also heard from a colleague that works here at RCMS at the dental clinic that there are a lot of people coming to her saying, is this really true? What do you know about it? And again, the main reason is hard to access the internet to see what's happening. Even the internet here where we live, where I'm at here at the RCMS building, the internet sometimes it doesn't work. So imagine, people that live up in the hills.
Okay, Javier, can you wrap it up, please?
Yes.
Okay.
So, I want to share some, some things that would be important. Put out weekly information on Facebook. A lot of the Latinos are on Facebook about even about simple things as symptoms, how to become infected, how to protect yourself, and maybe even cell phone text messages in Spanish would also help. Maybe having, again, the public health have a Spanish-speaking community liaison that would come and visit each area and talk to talk to the community. So that's some of the information that I want to share with you, and that I really want to thank you for this time.
Okay. Well,
thank you, Roseanne.
Yeah, thank you. Roseanne?
Kaylee Becerra.
Hi, everyone. My name is Kaylee Becerra. I'm from Fort Bragg, and like all of you, I'm a very concerned and frustrated community member, specifically because of the disproportionate impact of COVID on the Latinx community. We're 25% of the population, and here we are, 60% of the positive cases. So that's really alarming, really frustrating. I just wanted to start off by thanking Roseanne for putting this together. And I also want to share my frustration over the fact that it took this long to get a meeting and a word in with our county officials. I realize that there are many obstacles right now, but we know that this was going to happen. I mean, if what's been happening across the nation is indicative of anything, we knew this was going to happen. Our community is not immune to this. And so the fact that, it took this long, we had a community member who wrote a letter a month ago asking, for information to be disseminated, saying we're willing to work with the county. It's not our job, but we're willing because of the emergency situation that we're in. And the fact that it's taken, an entire month to even get to this point, I think is really frustrating. And just telling of the kind of the system and how it works and how it doesn't work in our community's favor, and precisely why the numbers are where they are. I mean, I know you guys mentioned there was maybe a meeting planned covering some of this and maybe some other things in March. And the fact that we're now at the end of July and having this is not okay. So I do want to point that out because we could have prevented so much. And I understand, COVID-19 is super overwhelming for all of us. It's impacting all of us in many different ways. But I think that the lack of outreach to the Latino community, the lack of communication, accurate and accessible information should not be a reason for so many people in our community to become infected with this disease. So with that said, I recognize obviously that there are, I want to propose, I guess, long-term and I guess short-term kind of action items and reiterating kind of what Loreto and I think Javier had previously shared, but long-term, obviously we need people in these positions. We need county officials from the Latino community who speak Spanish, who are sensitive, culturally and can relate to the experiences of many of the Latino community, specifically monolingual Spanish speakers. But obviously that's going to take time. But in the meantime, we need some immediate action precisely because we're in an emergency situation. I think that, COVID is really warranting us to come together and work together, which is what we're trying to do right now. But that includes, working with institutions where Latino community members are already a part of, as mentioned in a letter by Miranda Ramos, who's also on this call. And the letter that she sent to Dr. Duhan a month ago, work with the churches. The churches are usually a great place because people believe, most of what is being said there, most of the information that is being disseminated, they have cultivated a relationship with their pastor and with that community. And so for people who have been historically left out of these other structures that are, doing an inadequate job of providing this information. It's going to be great right now, the short-term immediate action to work with them, work with these existing institutions, whether that be the church, whether that be other community agencies who are already there, who have already cultivated a relationship with these people. So I know that the priest here, for example, Father Andre from the Our Lady of Good Counsel here in Fort Bragg, he signed on to the letter that I signed on to that Miranda wrote, saying, we're willing to disseminate this information. And they're trying, they're making their weekly writing the weekly bulletins, using their live stream services to provide information. However, it's not information that we've directly received based on that letter, because we haven't received any information based on that letter. It's been information that we as volunteers have been, synthesizing based on some of the ordinances and what we've seen on Facebook. So again, I guess my petition is to work with these existing agencies, and then just again do a better job of building a relationship with us, because again, there are so many people in our community who feel left out. Their fear, as has been presented earlier, to come forward and even test, or to believe any of what is being said. It all has to do with the fact that these structures were not meant for us, and so we need to make sure that we're restructuring what we have, so that we're all included, so that we're all safe. So that's my piece.
Hey, thank you.
Thank you.
Yeah. Maria Avalos. You're on mute. Maria?
Hello, everyone. Hi. So today I will be talking about how COVID has impacted personally in my life. And so just to start off, I want to talk about how, my family, and I have a lot of friends who come from larger families. So most of my friends, most of my family members, they share housing with other families, or there's multiple generations in a household. So when, social bubbles were kind of introduced, it was no doubt that people in the Latino community were going to have larger social bubbles. And with that, it was, I heard a lot about we're more trusting, where I heard a lot of I know who I'm around, I know who I am in contact with, and we're not going to catch that. So with that, there was, with being in close proximity, not wearing a mask, or, just not limiting contact how, right now we're being told to. So how COVID has impacted in my social bubble. So there were 5 people who were COVID positive over the last 2 weeks. And so this spanned over 3 households. And they immediately quarantined once they started showing symptoms. And one by one, they kind of all started saying like, I have symptoms too. And, started quarantining, getting tested, and getting time off of work. So during that time, they also possibly exposed their childcare, their coworkers, their clients, any friends, any family members also living in their households. And as of now, only one other known related case was related to this social bubble who tested positive. Luckily, no coworkers were infected, and that's probably due to, wearing masks and social distancing and things like that. So I was also exposed to COVID. So I had no symptoms, and this was before. This was for a birthday party, it was just 6 of us very close, and it was very small contact. And, once the other people started testing positive and showing symptoms, I started trying to notice it and see if I had any symptoms. I did not have any symptoms, but I decided to get tested anyways. And luckily I was negative. And I'm very glad about that, because I also, see my parents, and my father is high risk. He has a pacemaker. He's of older age. And my mother, she could have infected her coworkers, and my siblings could have infected their children who go to childcare. And it just, once you see how fast it spreads and how contagious it is and how many people's lives can be at risk, you kind of start to understand and kind of see how it is just spreading so fast through the Latino community. And that is because, you know, of the lack of social distancing, the lack of wearing masks. So it's just that having that trust within everyone. But right now, just like the county has been saying, is we all have to act as though we are positive ourselves. And I feel like that is where the miscommunication comes from, especially in the older generations of Latinos, because definitely, you know, when this all started, I was, you know, getting my parents in trouble, you know, don't go out to the stores unless you need to and things like that. But, you know, it's the older community, Latino community, who I feel like is having maybe a little bit a harder time following these social distancing rules and things like that. So that's where I feel like it should be heavily focused on. Thank you.
Thank you very much for that heartfelt story. Brenda Moreno Sanchez.
Hello, I want to thank you all for this opportunity. My name is Brenda Moreno Sanchez. I work with Health and Human Services, and I'm part of Mendocino Latinx Alliance. It takes a lot for me to speak in public, but I find it necessary now more than anything. My voice may shake, but I know I am not in any immediate danger. Spanish is my first language, and if I become embarrassed with something that I might say, you will start to hear my accent a little more. Again, I'm not in any immediate danger, but public speaking is something that I fear. In 2018, I was co-chair of UVA, Ucaya Vecinos en Acción, and we had hosted a community gathering dinner. We wanted to ask the community directly how to better serve our Latinx community during our natural disaster. We had just experienced the Redwood Valley complex fire. An older gentleman approached me and started to share his story. He said he was asked to take a crew to pick as much fruit as possible in the field. As long as the wind continued to stay steady, he was safe. He had his radio and could speak and comprehend English very well. About midday, there was a change in winds. The fire was now heading their way. He went for his radio and could not believe he was unable to comprehend what it was transmitting. He knew he had to leave. He see that the fire was approaching. As the gentleman told the story, I could see fear he continues to carry in his eyes. The gentleman was asked to continue to work, knowing that there was a fire. He loves his job and the people he works for. He became scared and embarrassed that he was not able to explain to his crew the information the radio was transmitting when the alert came on, putting all of their lives in immediate danger. My plea to you all is to consider this story. This person could speak and comprehend English very well. Part of our conversation was in English. He started to speak Spanish to me when he tried to express what he was feeling in that moment of danger and was unable to do so in English. His first language is Spanish. His first language was also Spanish. What is hard for us bilinguals to express to an English monolingual is when we are placed in a stressful and fearful situation, we automatically refer back to our most comfortable language. For both of us, it's Spanish. It just happens. I ask you all to consider having a certified interpreter translator to provide clear and direct communication for our community in a timely manner. The message must be provided by the county agency and not by a third party. And I say this respectfully. Having a clear, direct, timely information coming from Mendocino County and not by a third party will help the message integrity and not have the message diluted by the time it takes to get the message delivered to the community. I understand there are options such as providing a language line as a form of getting the message out to the community in a public, timely manner. A language line will not offer the connection and the meaningful engagement the Latinx community needs for the county, for our county and community. In less than 5 years, this county has stayed together during wildfires, PSPS power shutdowns. Now in this pandemic, our county needs to be united more than ever, and together we will overcome this pandemic. This will only happen if there is clear and direct communication directly from the county.
All right. Thank you very much. Miranda Ramos.
Thank you. Thank you, Chair Haschak, supervisors, county staff for having us here today. I'm really grateful to be able to be here in solidarity with my Latinx friends and neighbors. I was very appreciative for the doctor's presentation and also to hear from Dr. Duhan. And I have prepared some comments that I've decided I'm going to proceed with, even though I've thought lots of different things in hearing all of those stories. And I just want to express to my co-panelists here my gratitude for sharing your personal stories. So at this moment, I invite the supervisors and county staff who are on the call, take a moment and close your eyes and to picture the average person that you believe that you've been elected, appointed, or hired to serve in this county. And so that person that you're picturing, that's who you are creating and enacting policies, ordinances, and codes for. That person, the one in your mind right now, that's the person whose health and welfare you are protecting. That person, that's who you're communicating with about what's happening in our county during emergencies and also just every day. I know, of course, that you know, because I know, we all know intellectually that you're serving all of your constituents. That's what you're there to do. And not just those who look like the person who you pictured in your mind just then. And I also know that we're all human beings and that as we go about our day-to-day lives and as the stress increases and the duress increases, we act based on what that picture is in our mind. And we knew from what Dr. Duhan said, and we certainly heard from what Dr. Aguilera Gaxiola said, that the average person who's being affected in our county is a middle-aged Latinx person. It is not maybe that person who you pictured in your mind as the average. So I want to join my voice in solidarity with all of the leaders who are here on this call and echo their request for the items that they're asking for linguistically competent communication from the county, because we know that the folks who are being most effective need to be communicated to in a language other than English. And also, I want to encourage everyone, as you're moving forward on this, to be as creative as you can, as open as you can, and as willing as you can possibly be to continue to have these conversations, to engage in good faith and with the level of necessity, priority, and urgency, really, that's here to take this on. Thank you so much for your time.
Okay, thank you, Miranda. Is Fabiola Cruz on the line? I don't see.
Check. I didn't see her on here, and there was another speaker as well that was not able to get release time from work. So I believe that concludes it for our community voices portion.
Okay. Then we'll go back to you, Roseanne.
Thank you, Chair Haschak, and thank you to my colleagues for each of you for sharing your experience and your recommendations today on this important issue. I just want to summarize the requests again from the Joint Latinx leaders. We are comprised of 8 groups across the county, and we ask again for those 6 items that were listed in our letter to provide all information in both English and Spanish, to make translation mandatory in the county's emergency response plan, to add California certified interpreters to the annual county budget, allocate enough time during press conferences so that the same information is provided in both English and in Spanish, to host bilingual public forums for community feedback on county services, and to create an equity, diversity, and inclusion task force. On behalf of the 8 groups represented by the Joint Latinx leaders, we thank you for this opportunity and for the historic steps that we hope you take today. Thank you.
Okay, thank you, Roseanne, and thank you to all the speakers today. That was great. I'm going to go to the Board of Supervisors and see if there's any questions to any of the speakers. Okay, Supervisor Juror.
Yeah, well, just more of a comment to the speakers. I really appreciate both your letter that we did receive a couple weeks ago. I realized it went to the county staff maybe some time ago, but I got a copy about a week and a half ago and did respond when I got the letter. And maybe to county staff, when we wrap all this up, is I assume that you've been working with Supervisor Hashak on next steps to implement the proposals, and I've already communicated with the CEOs in support of the letter. So I'm hoping that we'll see some progress on all or almost all the items in the letter. Thank you.
Okay, any other comments from the Board of Supervisors? Okay, hearing none, we have a couple.
Chair Hashak.
Yeah, Supervisor McCowan.
Thank you. Come back to me, please.
Okay, we have a couple public comments. So, Deputy Clerk of the Board, are those people online?
This is Deputy Clerk of the Board, Atlas Pearson, and we had 2 folks sign up and neither is on the line.
Okay, it's unfortunate. So we'll go back to the board.
Mr. Chair, I'll try again here. I really appreciate the presentation, all of the speakers. I think it says a tremendous amount that the idea, I think you along with the community brought the idea forward in March. 4 months later, here it is. Some of what I say may make some of us uncomfortable. And I think if we want to move beyond where we are, we need to get more used to being uncomfortable. There's a national conversation going on right now about systemic racism. And one of the speakers made a comment that these structures were not meant for us. And that's why there's a lack of confianza, trust. And so we have a lot of work to do. We've heard some very practical solutions, some that I think can be implemented certainly sooner than others. Some of the 6 items on the ask, which again, not at all exhaustive, and we have, more specific 12 other statements. But I think we could agree as a group to give direction to move forward on these, and some of them, we hear the reports weekly about the cost of the COVID response and the contractual agreements that are signed that run into the millions and millions of dollars. So it seems like we could certainly contract for translation services to make sure that we're putting out the information. And I'd like to say one thing about my mindset. So we know that a lot of the recent cases relate to gatherings, or that's consistently been the information. And one of the speakers tended to confirm that. People like to get together, no question. And so, gosh, why don't people get it that these gatherings are where COVID can be spread? And I've heard the comment, including from a Latinx community member. Well, the people all know the information. They've all heard the information, but they haven't heard it repeatedly in their language like we all have. You know, all the information is always in English. It's always broadly disseminated. There's very little excuse not to follow it. I don't think we can say the same is true for the Latinx community. And so we do have a lot more work to do there. I support forming the coalition. Where could the capacity to do that come from? For several years now, the county has had a leadership initiative, which has been great as far as it went. Maybe we can transform whatever energy has gone into that to the coalition, or rather the Equity, Diversity, and Inclusion Task Force. And if Rosanna Ibarra doesn't have time to chair it, maybe Brenda Moreno Sanchez, who already works for us, could. I really think we need to move forward on this and not just say, great, thanks for the presentation, we'll be getting back to you. So again, thanks for bringing it forward. Thanks for everyone who presented. This is a good place to start on how do we move forward to correct some of the systemic ills in our society. Thank you.
Thank you, and I couldn't agree more. I think that we do have to do more than just talk about this. We need to start acting, and this is a critical time in this pandemic. So the time is now to get going on this. And certainly that's why the CEO and Dr. Duhan, our public health officer, brought this forward along with Roseanne and everyone from the Latinx community. So I very much appreciate that. I would like to see how we move this forward. So do we, like Supervisor McCowan said, do we move forward with the translation? Do we take those 6 points and form some kind of working group to see how we implement those, or what's the best way forward?
May I make a comment?
Yeah, Dr. Duhan.
You know, I want to thank, I really want to express my deep gratitude for the leaders in this presentation, and to let you know that what you're saying is right, and I am an ally for you. And I think part of the issue is that, in terms of the lack of communication, is that I think that we might not be sharing with you enough of what we're already doing. And I'm not saying this to be defensive, but when I hear the reflections of what you're experiencing on the front lines, I feel that there's a lot that we're doing that you don't know about, and that if we could share those things, we could build on those. So in our beginning, I talked about our isolation and quarantine housing. I completely agree with that we need to have professional interpretation. We need to have language. You know, this should not be a barrier. But to even go beyond that, so that should be a yes. But to go beyond that, for example, we have isolation quarantine housing, and we need to be able to activate that for our communities so that they know it's safe to come there, that they know it's a welcoming place. So I think there's some areas that we need to share on the part of the county that we've been doing. For example, we've been partnering with the community clinics. We've been, for Lucrecia Renteria, for example, in Fort Bragg. We have Anderson Valley up in Covelo with the Round Valley Clinic there. There's some work we've been doing that I'm afraid we haven't been sharing with this leadership group, that if we could build on that already, I think it's going to give hope and optimism as well, because we're not going from zero. You know, we already have some activities that I think would be really leveraged and made more powerful if we had our community leaders somehow working with us. together to make these more impactful and to build the trust there. So at some point, I'd like to perhaps have a strategy session to look at what is been working and how we can make it so much more effective when we have our community leadership partnering with us on those. And I hope that wasn't heard as me being defensive, because it's not how I intended it, but just more that I think we need to even do more to communicate with our leaders about where our areas of strength are so that we can build on those.
Okay, we do have a caller who had a telecomment, so we'll go to that caller now.
Michelle Frederick is now on the line.
Good afternoon. Michelle Frederick. Okay, we'll come back to Michelle. Okay. Any further comment from the board or any kind of direction?
Well,
Mr. Chair, I'll move. Mr. Chair?
Yes.
I will move that we direct staff to move forward with creation of an equity, diversity, and inclusion task force initially focused on the additional requests that were enunciated.
Okay.
I'll second the motion and request that the chair work with staff to implement as much as can be implemented as quickly as possible in the letter.
And I will accept that amendment to the motion. I think it's an excellent suggestion. And so again, I think the intent, let's implement as quickly as we can things that should be achievable in the short term while we plan and work on the other items.
And I certainly accept that and would be honored to work on it.
Chair Hashjack.
Yes.
This is CEO Angelo. Just two comments. One, I want to thank all of our speakers. This was, a really good presentation, and I really appreciate it. And what I appreciate more than anything is coming forward with recommendations and suggestions, because so many times community members will come before the board and they have great presentations, but we don't have next steps. So I want to thank the board for entertaining the concept of having this presentation, Chair Hashjack for all of his work, and certainly Dr. Duhan. And I assure you, Chair Hashjack, that as your CEO, I already have some ideas as to how we could move forward with these recommendations. And I would like to share those ideas with you this week. So I think the direction of the board is so noted, and that direction can certainly take place rather soon. And you and I can talk this week. So thank you very much.
Okay, excellent. All right, any further comment from the board? So, Supervisor Brown. Oh.
Sir?
Yes.
What is the question?
Okay.
Do we have a motion?
Yes. See, Deputy Clerk, could you repeat the motion?
I'm sorry, I'm going to need the motion repeated.
Okay, Supervisor McCowan.
Thank you, Mr. Chair. The motion is to direct staff to move forward with creation of an equity, diversity, and inclusion task force, initially focused on the 6 requests that were made, and with further direction for Chair Hashjack to work with staff and the community on implementing these measures.
All right. Everyone clear on that? Okay, so Deputy Clerk, could you do a roll call vote?
Absolutely. Supervisor Williams?
Yes.
Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Supervisor Jurdy?
Yes.
And Chair Haschak.
C.
The motion carries unanimously.
All right. Very good.
Actually, I think instead of directing Chair Haschak, I meant authorizing Chair Haschak.
Okay.
Would be
Very
more
good.
proper board speak.
And again, I'd like to thank all of the people who helped put this together. Certainly thank you to Dr. Aguilar Gaciola, and everyone, Rosanny Barra, Dr. Duhan, Carmel Angelo, and all the speakers who came forth and gave very heartfelt and important messages to our community. So thank you very much. With that, let's see. Let's take a break until 5:25, and then we'll come back and try to get some more work done. Okay, thank you all.
Thank you, Chair Haschak. Thank you, supervisors.
5:30 rule to figure out the agenda for the rest of the day?
Not Supervisor Brown.
Chair Haschek, I have never called the 5:30 rule and am not about to start. Thank you.
Very good. Okay, not hearing anyone going to call the 5:30 rule. We'll continue on with item 5D. Okay, discussion and possible action, including possible appointment of an ad hoc committee regarding responses to the 2019-2020 grand jury reports. Sponsors, County Council.
Thank you, Mr. Chair, members of the board. So, once again, it's time to be preparing a response to the grand jury reports. I would ask that the board create either one ad hoc to assist in crafting responses to all of them, or if the board would prefer separate ad hoc for the separate reports.
Mr. Chair?
Yes, Supervisor Brown.
Thank you, sir. We started these ad hocs a number of years ago, and I think on each one, Supervisor McCowan has served, so I'd like to nominate him.
Okay. Is there someone else?
Chair Haschek?
Yes.
I am certainly willing, particularly Teeter, where and it's a complicated topic. I understand that. I think the grand jury misunderstood a couple of things there. The issue of school safety, obviously a top priority. The county's not necessarily the lead on that, but certainly should be supportive of all the school districts. Emergency communication system in Mendocino County, the grand jury has identified a critical need that our staff had already identified, and the board had already moved forward implementing a plan to upgrade our emergency communication system. So I think they're, all topics that there's reasonable responses to. We have had these ad hocs for a number of years. I think they've worked well. I would note that maybe it was 2 years ago, maybe even last year, we had 2 ad hocs. But I'm certainly happy to serve with anyone on any of these. And, I'll leave it at that, but I'm happy to serve. Thank you.
Thank you. Right. Is there anyone who'd like to be on the ad hoc with Supervisor McCowan?
Hearing no one come forward, I don't know, Mr. Chair, if you would like to. If no one else wants to serve, I will be happy to do so.
Okay, if you could do that, Supervisor Brown, because I'd appreciate that. All right, so.
I would only note we're moving away. We usually try to have geographical diversity. I don't think it's essential, but it's often helpful. The emergency communications, we have a couple of supervisors who've been working directly on that. Possibly we would delegate that one to Supervisors Juror and Williams, who certainly have more familiarity with the topic than I do. A lot more technical expertise, certainly.
So what you're saying is that you and Supervisor Brown would deal with Peter and the schools, and Supervisors Juror and Williams would deal with the emergency communication issue.
I do think that's a reasonable approach, but I'm open, willing to take on all of them if the board so directs. But I think we might have our strongest team if we did have Supervisors Juror and Williams respond to the emergency communications report.
I could agree to that. It's a good idea.
Okay.
Yeah, sure.
Okay, let's go to public comment. Do we have any public comment on this? Hearing
No, we do
none?
not.
I don't think anyone signed up for this. So we'll go back to the board. Okay, is there a motion? Is there a motion to accept what Supervisor McCowan said about having the two ad hocs deal with the grand jury reports?
Mr. Chair?
If you so desire, you could simply appoint the ad hocs.
Okay, I'll appoint those ad hocs as noted. If that's all right with everyone? Good? Okay.
Yes, sir.
Moving on. Okay, agenda item number 5E, discussion and possible action, including introduction and waive first reading of an ordinance amending chapter 2.14 of the Mendocino County Code entitled Compensation and Mileage for Grand Jurors and Petit Jurors. Sponsors is County Council and Executive Office. So,
Mr. Chair, if we can move out of process a bit, I would move approval.
well, let's have them introduce, okay?
So I think I'm hearing I should keep it brief. Thank you, Mr. Chair, members of the board. So this is a modification of the ordinance. By statute, there's a minimum compensation that's set for grand jurors, but the board has the authority by ordinance to set a higher rate of compensation. The grand jury has had a little bit of trouble staying in budget, and this was actually sort of the recommendation of their leadership as to a way that they'd be able to address that. I've outlined in the accompanying materials sort of the primary changes, but the objective here is primarily to reduce the limit attached to their compensation for lunches and increase the requirements from 2 hours to 3 hours of participation, and only for in-person participation before they're compensated for lunch.
Okay, very good. Is there any other comment from the board? Okay, public comment. Do we have any public comment on this? Seeing none, hearing none, we'll go back to Supervisor McCowan.
Thank you, Chair Haschek. I move approval of the recommended action.
Second.
Okay, it's been moved by Supervisor McCowan, seconded by Supervisor Williams. Okay, any further comment? Hearing none, could you conduct the Deputy Clerk, could you conduct a roll call vote?
Absolutely. Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Chair Haschak?
Yes.
Supervisor Jurdy?
Yes.
And Supervisor Williams?
Yes.
The motion carries unanimously.
Okay, so we're going to go on to closed session. We have items 9B and 9C to deal with. So with that, Deputy Clerk, are you going to send us a new invite?
No, you will use the, this is Deputy Clerk Lindsay Dunham. You will use the same invite from earlier to return to closed session.
Okay, very good.
If I could ask for clarification, is that the second of the two closed invites that went out?
Yes, that's I'm sorry. Yes, that's the second one. Please. Thank you.
Okay, and we'll go right into closed session. Good. Okay, we're back in the open session. Let's see, on item 9B, direction was given to staff, and also on 9C, direction was given to staff. So Supervisor McCowan had something to say about item 6C.
Yes, thank you, Mr. Chair. I neglected to mention that I had a recent conversation with Rakesh Patel, who, working with the local hoteliers in the greater Ukiah Valley, mentioned that they had masks available. And I mentioned the potential need for outreach to the Latinx community. He told me, ask them how many masks they can use, and they would be willing to try and meet that need. So I wanted to put that on the record and pass that information along to you when you're doing your outreach with the coalition. Thank you.
Okay, thank you. We certainly thank Mr. Patel for that offer. With that, we are not going to do supervisor reports this evening. So at 6:27, I'm going to adjourn the meeting. Right.